Sorry, Chair.
Okay, thank you, Clerk, and good morning, members. Maji and Wai agus to Fáilte Road, very welcome to this morning's Health Committee meeting. I declare the meeting open to the public online, and I would like to welcome all of our members who are participating by video conferencing today to maintain the social distancing guidelines that are in place. I would also like to remind all members about the protocols regarding the use of electronic devices and to ask all members and panel members to ensure that they are on mute when they're not speaking and to use headsets if possible. Okay, members, given the change of time to the executive meeting, would members agree that we move straight to the Minister's briefing and then we'll revert back to our normal agenda back after that time? So we will, thank you, members. We'll then go straight to the briefing from Minister of Health, and he is joined today by officials. So I can advise that members, it is Mental Health Awareness Week, and the briefing from the Minister this morning will have a focus on mental health issues. I can advise members that the Minister will be joined by departmental officials. The Minister has advised that he will have to leave by 10:15 to attend the executive meeting, although officials will be able to remain if required. So I'd now like to welcome this morning to our meeting Mr. Robin Swan, Minister of Health. Good morning, Minister.
Morning, Chair.
You're very welcome this morning. Dr. Thomas Adele, who is Head of Mental Health and the Capacity Unit. Good morning, Thomas. Can you hear us okay?
Good morning, I can hear you fine, yep.
Thank you. And Mr. Peter Toogood, and Peter is Director of Mental Health. Are you able to hear us okay, Peter?
Sorry, Chair, I don't think we have Peter on the call yet.
Okay, so we'll probably go ahead and if the Minister's content, we'll go ahead and Peter can join in and can be brought in then when he arrives into the call. So I'll go back to yourself then, Minister, if you want to go ahead and give us your briefing today, please.
Certainly, Chair. My opening comments will be, I suppose, a bit more longer than the usual COVID update that I give before we go into questions. But Chair, committee members, can I thank all of you for inviting me to speak today about one of my top priorities and one of the most important aspects of my department's remit, that of mental health. As you've already acknowledged, Chair, today's executive meeting is slightly earlier than usual, so I'll have to leave around 10:15, but officials will stay on to allow the discussion to continue. I'm also aware of the committee's motion next week, and that will provide another welcome opportunity for us to come together to discuss this very important issue further. Chair, as you've said, given that this week is Mental Health Awareness Week, it's entirely appropriate that we give this topic the platform and focus it deserves, because it's hugely important that we use this opportunity to strive to reduce stigma associated with mental health, to improve support for those who need it, and to secure the resources to ensure we have a system that adequately cares for our community. Before I do begin into the main, I'd like to introduce Peter Toogood when he does join. Peter's my department's new Director of Mental Health. Peter has recently joined us to take up what is a newly created post, which will allow my department to put an even greater focus on mental health and put it on a much more even footing with physical health. This is a really significant step forward as it provides a dedicated senior civil servant resource for mental health, actually for the first time. I'm also joined by Thomas Adele, who is Head of our Adult Mental Health Policy, and a key member of Peter's team, who, Chair, I know you and the committee know well. This morning, I'd like to give you an overview of the work my department has been doing and is planning to do to improve outcomes for those who suffer from mental ill health, as well as challenges that are facing mental health services, not least due to the pandemic. Members will be aware that to mitigate and address the initial impact of the pandemic on our population's emotional well-being and mental health, in May last year I published a mental health COVID response plan. That plan set out a range of key actions my department and its agencies were taking forward to support our communities during the initial period of lockdown and beyond. This included the development of digital means of support, such as access to online stress control classes, the development of bereavement support resources, as well as the joint development of the COVID-19 Wellbeing Hub, and that was done in conjunction with the Department for the Communities and Inspire Wellbeing. A range of other resources were developed, for example, to support students joining the health and social care workforce early and provide support for children and young people. All of these resources continue to be available for those who need them. Chair, mental health services, as we know, were under considerable pressure before the pandemic, and they are now experiencing unprecedented challenges. Inpatient services are under extreme pressure. Our mental health staff are hugely dedicated and caring, highly skilled and committed, but are doing a very difficult job in increasing difficult circumstances. An already difficult position has been compounded by the impact of the pandemic. Our trusts are reporting increasing referrals as well as heightened acuity of patients. Trusts operate consistently above 100% bed occupancy levels in mental health inpatient units, and those patients who are admitted are often much more seriously ill than would usually be expected. So it's really important that people understand what operating above 100% capacity means in that context. It's simply that this places additional pressures on already high-risk staff, compromising their ability to provide the care and treatment patients need. What this means is that people whose mental health needs are such that they need to be admitted to hospital. People who are in crisis, who are seriously ill, are being asked to sleep in armchairs and on sofas in hospital. The statements we all make about tackling the stigma attached to mental illness must feel a little hollow to people finding themselves in that situation. And I must emphasise that this is not simply a problem of not having enough inpatient beds, because too often this situation arises because beds are having to be used for people who cannot be discharged because of the absence of the community services that they need. It is highly likely that these pressures will continue as the mental health surge we have all been anticipating begins to bite over the coming months. Indeed, evidence from other countries indicates that we are only at the beginning of that surge, dealing with the knock-on effects of not just lockdown, but the pandemic itself. Even as our society is now beginning to take the first step back to normality, the impact of the last year will have a lasting effect on our communities and their mental health and on the services that support them for some time to come. And in particular, mental health inpatient bed pressures are likely to continue. But to deal with these severe pressures in the short, medium and longer term, a number of key actions are being taken forward by my department and its agencies. So to deal with the inpatient bed issues in the short term, the Health and Social Care Board has established a regional bed flow network. This group is meeting weekly and is looking at a number of options to increase capacity in the short term and the medium term as well. But in the longer term, the provision of psychiatric, low secure inpatient and mental health rehabilitation services are likely to have a positive impact on patient flow and bed capacity, as well as providing better outcomes for patients. I've recently approved the policy direction in both of these areas, and that work can now start to develop those detailed proposals. A comprehensive review of crisis services has also recently been completed, and its outworkings have the potential to have a significant positive impact on people in crisis and on pressures on services in the longer term. And once my officials and I have had an opportunity to fully consider those recommendations, I will also make a decision on the way forward and have that conversation with yourselves, Chair. These reviews and a number of others were commissioned as part of the Mental Health Action Plan that I published in May last year. And I'm pleased with the progress made in the implementation of the action plan, because most of the 38 actions are either on target or are substantially completed. Some notable achievements to date, Chair, include the creation of a mental health champion, the approval of the business case and securing recurrent funding of 4.7 million for the development of a specialist perinatal mental health community service model, the establishment of the CAMS and forensic managed care networks, the launch of a mental health innovation fund, and as I have just mentioned, the completion of reviews of crisis services transitions from CAMS to adult mental health services, or eating disorder services, personality disorder services, psychiatric, low secure inpatient services, and mental health rehabilitation services. The outworkings of
Sorry, Minister. Sorry for cutting in there. It's a wee bit. You're breaking up a wee bit at times there. I'm just wondering, is there anything you can do sound wise? We're following it so far, but it did dip a wee bit there. So just to advise you of that, Minister, if you can maybe. I'm not sure if there's any way to improve it, but apologies and please go ahead.
No, you're wrong. No, you're wrong. Colin, it's better that we hear this. Thanks for that. That any better?
Yeah, that does seem a little better. Yeah.
Right. Sorry, Chair. And go back just in regards to those number of reviews that have been that completed. The outworkings of those reviews will help inform future strategic policy, and the completion of these actions actually represents a significant step forward for mental health in Northern Ireland. The action plan also committed to developing a new 10-year strategy for mental health in Northern Ireland. And this, I believe, is the best way to address the historic issues facing mental health services, to face up to and meet the increased demand caused by the pandemic, and to put in place real and lasting change that will significantly improve mental health outcomes for people in Northern Ireland. Committee members will be aware that I published the draft mental health strategy 2021-31 for public consultation in December last year. And following an intensive period of co-production, the consultation concluded at the end of March this year, and in total, Chair, with 428 responses. And I was delighted with the level of interest and engagement generated by this work, and I'm very grateful to the large numbers of individuals and organisations who contributed to the process, both during the co-design phase and in response to the consultation, because their input is really valuable. The response to the consultation has been overwhelmingly positive, with over 82% of formal responses received assessed as positive, and many of the comments and suggestions received will be reflected in the final draft of the strategy. The draft strategy itself sets out a number of actions to take forward significant reform to mental health services. Its key aim is to ensure long-term improved outcomes for people's mental health, putting the individual and their needs at the centre. It focuses on the promotion of well-being across the whole lifespan and seeks to ensure consistency, equity of access and choice for those accessing mental health services and support. The strategy is my department's long-term strategic plan to address the pressures of mental health inpatient beds, to meet the increased needs created by the pandemic, and to put mental health on an even footing with physical health in this country. I also hope it brings us in line with the mental health provision in other parts of the United Kingdom, and indeed, once fully implemented, ensures Northern Ireland has a world-class mental health system to be proud of. And I hope to be in a position to publish that final strategy in the summer alongside a funding plan setting out the resource requirements to implement it. Chair, one of the other areas I wish to mention during Mental Health Awareness Week is children and young people. Because for many children and young people, the pandemic has had a significant impact. The loss of daily structure that school attendance normally provides, alongside reduced social contacts and support in school, could lead to deterioration in mental health. The support that my department put in place at the beginning of the pandemic provided valuable resources for our children and young people when they needed it most. In addition, my department funds a number of community and voluntary organisations that continue to support young people during the pandemic. For example, the Public Health Agency's FLARE programme, which aims to support young people who are struggling with mental ill health, suicide ideation or previous suicide attempts. Furthermore, my department has worked collaboratively with the Department of Education on the development of the children and young people's emotional health and wellbeing in education framework. That was launched in February 2021. And the framework comprises a range of initiatives aimed at delivering better mental health outcomes for children and young people, and will be especially important at this time, given the impact of the pandemic. £5 million from the Department of Education and £1.5 million from my department has been allocated to fund that plan. Some programmes in that have already commenced, such as the Health and Social Care Trust Text and Nurse Service and the Education's Authority Youth Service REACH, which is Resilience Education Assisting Change to Happen programme. While others are pending business case approval, that also includes a new child and adolescent mental health service, CAMS, emotional wellbeing teams actually in the school service, which will involve the teams working directly with schools alongside other services. But Chair, unfortunately, despite the great strides forward we have made as a society in terms of talking about mental health and the progress made over the last year, I must also reflect the reality of the position we are in regards to funding. As members will know, mental health services in Northern Ireland have historically been underfunded in comparison with other UK jurisdictions. Mental health in Northern Ireland receives between 25 and 30% less funding per capita than in England, despite many indications that mental health needs in this country are greater, not least because of the legacy of the Troubles. And that equates to a funding gap of approximately £100 to £150 million per year, which is a dire reflection on the low priority we as a society and in the past as a government have actually afforded to mental health up to now. The particularly difficult funding position that my department is currently facing does not make redressing that imbalance any easier or any more likely, and indeed no funding has yet been identified to support the implementation of the strategy. The capital budget position also remains severely constrained, and without additional resources on the multi-year budget settlement, my department is unable to commence any significant new investments that will continue beyond this financial year. All of this limits my options and our options in terms of addressing the current challenges facing the system and in implementing the strategic improvements greatly needed and so long sought for by our communities. Full implementation of the strategy, which all stakeholders are fully in support of, will require significant investment to ensure that and achieve what we want and what our society deserves will require full support from the executive and across Assembly parties. We absolutely, in my opinion, must now walk the talk. If we are truly serious about making mental health a priority, as so many of us in government and the Assembly and this committee genuinely want to do, then we have to do our utmost to get the resources in place to do that. But in the meantime, I can assure you, Chair, that I will continue to work to make resources available where I can and to continue to make the strongest case possible to my executive colleagues for a significant increase in funding for mental health. A key element of this will be the funding plan, which I will publish alongside the final mental health strategy. And this will set out more clearly the funding requirements to see that strategy implemented, as I have mentioned. The figures will be significant, but now is not the time to bury our heads in the sand, because we've seen the needs of our communities increase during the last year. We know it is unlikely to significantly improve, and we are building on a shaky foundation of years and years of underinvestment. Now is the time for action, Chair, and I trust that the committee members will be supportive of all attempts to secure additional resources to achieve our strategies, aims, and improve mental health outcomes for all in Northern Ireland. As I have said, I will continue to work hard to secure whatever resources I can for mental health within my own department. And Chair, one of the most significant actions I have taken in the recent weeks was the establishment of a £10 million mental health support fund, which will provide grants to charity organisations who provide interventions to improve the population's mental health. Because I want to fully recognise the hugely important role our community and voluntary sector plays in supporting our community's mental health, providing much needed advice and wellbeing support, as well as commission services as part of that stepped care model. I also recognise...
Sorry, Minister, I'm really conscious of time, and I do want to get to some questions, so I'm just wondering, can we...
I'm coming to a conclusion here, Chair, and as I said in my opening address, this is a very important issue for me, for my department, I think for the work that the committee has done, and Chair, I do want to acknowledge, although I've been coming to the committee regularly on a monthly basis, it has been for COVID response, and I think, and I welcome this as a full engagement of another policy area that I want to know that I think we can work very strongly together in. So in regards, as coming to a close, Chair, in regards to the work of the community voluntary sector, because I think we all want to recognise the hugely important role our community and voluntary sector plays in supporting our communities' mental health, providing much needed advice and wellbeing support, as well as commission services as part of that step care model. And I also recognise that organisations in this sector have come under incredible pressure during the pandemic as they seek to support more people with less resources and in a hugely difficult circumstance. In recognition of that, the new Mental Health Support Fund will equip and enable these charities in providing a wide range of support services for people with mental ill health and help to ensure that those who need to can continue to access mental health support services in the community. The fund is expected to formally open within the next few months and will be accessible through the Community Foundation's website. Chair, in conclusion, I thank the committee for its focus on mental health today, and I know we all share the same frustrations on the current pressures on services and the same desire to make things better. And I trust members are reassured and assured today on the scale of ambition from my department and from myself. Because I will also want to emphasise that without sustained recurrent funding, we will be limited in what we can achieve jointly. I know in recent weeks, my Department's Director of Finance has given you a stark assessment of the budgetary situation facing our health service. That situation is concerning. We have, of course, many serious problems in health and social care, and these problems cannot be fixed just by long-term funding alone, but equally they cannot be fixed without it. So in closing, Chair, I would like to reiterate my complete commitment to improving mental health services and mental health outcomes for all the people of Northern Ireland. There are many challenges on the road ahead, but I'm determined to continue to strive to ensure that all those who need help can access it when they need it, and to give the people of this country a mental health system that they can be proud of. Chair, thank you for the time to make that statement this morning, but as I say, I think it was important to set out that full case in regards to what is a very important issue.
Okay, thank you, Minister. So I suppose I'll just go with maybe a quick round of questions from each member before the Minister, and then we'll come back to another round of questions. So if members want to tailor their questions in that regard, remaining conscious of the time restrictions this morning. So, Minister, in terms of myself, and I do welcome the direction and the commitments and all of that. I suppose one of the things I am concerned about in the action plan is in relation to Section 13 there around workforce and building a stronger mental health workforce. And we have met this week with the Mental Health Policy Group. We've met with other workforce representatives and community sector representatives over, and clearly none of this can be delivered. The most basic and fundamental building block of that will be the workforce. So I am concerned to see within the action plan that in terms of workforce, the costs are to be scoped, the timeline for review is still to be scoped, and yet there will be a significant lead time to recruiting and training that workforce. So can you tell me anything in relation to how that can be prioritised and what we are looking at in terms of planning for what would be needed for a mental health workforce?
Chair, I'll let officials pick up on the specifics of that when they come on to address that. But it is part, as you've known, we've been receiving the depletion of workforce across the health service over the past 10 years. It has affected all sectors equally. In regards to the 300 nurses that are coming on each year, they are over a number of specialties. So you're right, this investment takes time for completion. There is no ready workforce sitting there waiting for us to put out a job advert for. And I think if you've seen the number of trusts who have actually been advertising for key positions over the last number of weeks when we move into the financial year, have actually indicated that there's a desire out there to fill these positions, but it is about getting that appropriate scope and time for training, because we have not been investing in that workforce. That's why we were where we were this time last year in regards to concerns being raised by our trade union colleagues as well. It was about that long-term challenges, but also about succession planning, Chair, as well, because without that continued recruitment process, it has been hard to put that succession planning in place. So I'm sure Peter and Thomas can pick up on those specific actions in more detail later on.
Okay, yes, I'll go back to that. For now, I'll go to members there, and so I'll go first of all to Deputy Chair Pam Cameron. Go ahead, Pam, please.
Thanks, Chair, and thank you, Minister, and your team for being here this morning. I know you don't have much time. I want to ask you specifically around what progress has been made towards a regional bed approach management, and I'm also wondering if you want to answer whether there's a case for reform of the trust model within Northern Ireland, and I say that on the back of how well the trusts have all worked together through COVID. It has been very impressive how they've been able to work together, and given the very small population that we have, is there a case for reforming that trust model and making it better? And also, have you made any progress towards that regional approach to the bed management issue?
Thanks, Pam. And look, sincere apologies about having to go, but the executive was earlier this morning than it usually is, because I would have liked more time to talk about this. And in regards to the regional bed model, the Health and Social Care Board already have a manager in place to look at that, because it's what we learned. Again, it's one of the learnings that come out of COVID, to manage that system, because as I said in my opening addresses, when we're looking at over 100% occupancy of our mental health beds over the weekend, mostly at weekends, apologies, but over the pandemic as well. That's where we looked at that approach, and that's where we seen, and again, it is about where we seen that regional coming together, where the 5 trusts began to work as one, especially in regards to the supporting of how they could, in regards of the likes of mental health and other specialities. In regards to, I suppose, the longer look at the trusts in regards to the functions of them, I don't want to get into party policy, but Ulster Unionist parties have always said we should have one trust across Northern Ireland. But there may be an opportunity that there may be, and this is only for future scoping or discussion, that we may look at for a single mental health trust that covers the entirety of Northern Ireland, so that we can look at a regional approach to standardisation of service and provision, and remove some of the challenges of what in the past has been a postcode approach, unfortunately, to some of the service models that we've looked at. But in the longer term, there is no department direction at this minute in time for single trust, as I say. That is something that we put forward as a party policy. But the regionalisation approach is something that has really been embedded through the pandemic, something that has worked well for us and something that we want to build on, because we've now moved from that silo mentality that we've seen in the past, which has been challenging.
Thank you.
Okay, thank you, Pam. And going then, so in order now, I have Cara, then Carol, then Orlia, then Paula, then Jerry, then Alan. Those are the indications I have in front of me at the minute. So I'll go to Cara Hunter now. Go ahead, Cara, please.
Thank you, Chair, and thank you, Minister and panel, for being here this morning. And Minister, when you speak, you can definitely tell that you have real passion around this subject, so that's most welcome. My question this morning refers to the work of community crisis intervention services. These services are always in high demand, yet oftentimes they do struggle to get that crucial funding. My question is, have you had any recent conversations in your department about longer and more sustainable funding? Just because I do know that the one based in the Northwest is exceptional work. Thank you.
No, Cara, in regards to crisis services, it is something I know that the Royal College of Psychiatrists found that, I think, was it 40% of mental health patients have been forced to resort to actually emergency or crisis services, and 1 in 10 in distress actually end up in the emergency departments. It's not the service model that we want to provide, especially for mental health. Early intervention prevents that, and that's where our crisis service comes into part. But recognising the need to improve mental health crisis response in Northern Ireland, actually one of the actions, I think it's actions 8.4 in the Mental Health Action Plan, centres on the reconfiguration of mental health crisis services, and it was agreed to be prioritised because providing that better crisis response is seen as one of the keys actually to unlocking the ability of the entire system to respond better, because if you can get that part to work, In regards to the financing models of crisis services, I was up in the northwest actually with Tomas on Friday, and in regards looking at the work being done by the Western Health and Social Care Trust. But there's also an opportunity for many of those organisations who have been providing a crisis response without core funding to apply for the new mental health support fund, which I recently announced. There's £10 million there, which will be handed through the Community Foundation in response as well. So there's additional supports that they can look for there. But the core challenges of my department through funding is something I've rehearsed. It's something I think committee members are well aware of and alive to about the challenges it places on us.
Thank you.
Thank you, Cara. And Minister, your sound is dipping a wee bit there again, just towards the end of that answer to Cara. So just if there's anything you can do on that. Going then to Carol Nichillen. Go ahead, Carol Liddehall.
So, good morning, Minister. My question's really in relation to, so for example, you're responsible for making bids and you're responsible for your own budget. So while the budget isn't where it needs to be, it's your decision what levels of money go against mental health. So I just want to make that point. The second question I have, or the first question I have really is, it is a postcode lottery, particularly if you live in North and West Belfast when it comes to mental health services. And recently our accident and emergency almost reached crisis. And a lot of those people, be it older people, a lot of them are struggling with mental health. So given the fact that there is nowhere for people to go who are in mental health crisis and indeed suffer addictions, then how's this figure going to be reduced? And the last thing I'll say is this, Minister, we had a presentation from your officials last week on health inequalities, and it was stats. There was no policy on it. So unless you actually get to grips and address the current health and mental health inequalities, then we're going to be having this same conversation forevermore, unfortunately.
Yeah. And Carl, I think in your last point on health and mental health inequalities, I would make the point, and you know this as well as I do, it's not just health. This is about a whole system approach. This is about communities. You know, you and I worked together when you were Minister of Communities. This is about how we improve people's position in life. Health inequalities come about because of poor housing, because of lack of access to education, because of poor job opportunities as well. So when we talk about health inequalities, those stats that we measure are the outcomes of that lack of investment and action in other areas. So when we look to the programme for government, that's where we start to address those. What we have to do, and as a health service, what unfortunately we're left to do, is pick up the end of those inequalities. So when it comes to the additional pressures on our A&Es, because of those inequalities that are systemic throughout postcodes and certain areas, that's where we see those additional pressures, and that's where we have to put the support mechanisms in, again in crisis response in the vulnerable community sector. So we get that early interaction, and I met a number of the North and West Belfast organisations a couple of weeks ago, in regards to how they can, the work that they actually are doing as well, but the more work that they can do to get that early interventions in. And again, hopefully that £10 million that we're announcing will help them to do that. Carl, we shouldn't be relying them on for those community and voluntary services to do it. But if they can help us now get over this crisis over the next 2 to 3 years, so that we can get the mental health action plan and strategy into place, so that the core health service functions are there to actually support people. That's what we need them to do. So this is about partnership, this is about co-production, this is about co-working.
Okay, thank you. And going then across to Orlia Flynn. Go ahead, Orlia, please.
Thank you, and thanks, Minister, for the briefing. I suppose maybe just to follow on from some of the points that Carl made, I am a wee bit disappointed at the briefing today. I think even when we spoke to the officials the other week, when they were talking about the mental health strategy, in their words, they were saying it was difficult to achieve any certainty on these plans, which was disappointing then. But I think I'm even more disheartened this morning, because I think basically what you've set out, and I completely appreciate all the work that's been done, the perinatal, the £10 million, But all of that is really a drop in the ocean. And I think what you've set out this morning is, in your own words, that your options are limited, that it's going to be difficult to address the imbalance with mental and physical health. And basically you've set out that there's no funding. So while we have all these great initiatives that are being progressed in the crisis review and Protect Life 2, the 10-year strategy, and more specifically the substance use strategy, I am just really worried that we've got to this point and we're not going to be able to push any of this on any further because of funding. And I accept that your budget's tight, but I know, Minister, at a previous health committee, you did give a commitment to increase the amount of spend from your budget onto mental health. The officials weren't able to confirm that with me 2 weeks ago either, so I'm waiting to hear back as to this most recent budget. What is the percentage figure that's being spent on mental health? And I mean, the health inequalities briefing that we had last week, the biggest health inequality, I accept that it goes right across the board. But in terms of health, the biggest health inequality is drug and alcohol related deaths. So I'm just worried, to be honest. In your budget that you have at the minute, what are you actually spending on mental health, and particularly on the substance use strategy and the mental health strategy?
In regards to the substance use strategy, because it hasn't been published yet, or the mental health strategy, as I say, we'll put fully costed proposals against that earlier. But again, as I said, I'm already 100 to 150 million pounds short in regards to that. I'm already, and I think as my officials have briefed, we're at a standstill flat cash budget. So to do the additional funding to mental health, we have to strip it away from somewhere else. So that's how we have to, that's the decisions we have to make in the department. But that's why we bring forward these strategies, implementation plans, to really show the cost benefit analysis. It's hard for me, and you'll understand this too, to have to put that monetary figure on what we want to do, on what we know we need to do. But unfortunately, that's the system that we're in. I have to make bids. I have to prove it. We know, and that's where we'll get to, and that's where we're at. And where I have been able to allocate money, we have, in regards to the perinatal, regional approach. We want to get to the mother and baby unit. I need a business case to do that. We're working on that. This is about the building blocks now, or Leah, on this, and you and I have met and talked about mental health. I know we're both coming from the same place. The challenges and I've been open and honest in my statement in regards to the challenges that we're facing financially to do the work that we want to do. And what we're trying to do is set out that evidence base so that I can convince other ministers that this is where money needs to be focused. It's a challenging budget. Conor will tell you that as well. I get a flat cash budget, so I had to, we have to progress that where we can, but also make that bid for recurrent funding, because that's when we start to see that long-term strategic change that we need to do. And while, the £10 million sounds a lot, but it's a drop in the ocean in the support to the voluntary and community sector. But it's another avenue that we are utilising because it's there. It needs funded, it can support, and it can help us achieve the goals we want to.
Okay, thank you. And I do recognise members' frustration with the amount of time we're getting with the Minister on this very important issue this morning. It is regrettable. We did ask for an earlier start in light of the executive start, but however that wasn't possible. So we're dealing with a very tight time frame. So I appreciate members' adherence to that. I'm going now to Paula Bradshaw. Go ahead, Paula, please.
Good morning, Minister. Thank you for coming this morning. I wanted to focus in on the eating disorders review. Obviously, during COVID, a lot of people put on weight, but we also know that there were a lot of pupils who maybe started manifesting, restrictive eating. And I know that some of my constituents' children actually ended up at the acute end of that. So I'm just wondering, to what degree is the review that's in the draft strategy, is that looking at not just restrictive but binge, but also overeating? Because we know then obesity then puts pressure on the rest of the health service. To what degree, to take it in those sort of pastel highlighter children who could potentially end up with anorexia. To what degree are you engaging with the schools around that? And then lastly, Minister, in the Queen's speech this week, she indicated that legislation could come forward in Westminster around putting calories in restaurants, and to what degree is your department thinking of introducing that here in Northern Ireland? Thank you.
Thank you, Paul. On the last point, I heard it in the Queen's speech as well. Food Standards Agency would usually take a lead in regards to that. I don't have a more up-to-date briefing on that. In regards to the specific school provision, and that's in regards to the joint work that we've done through ourselves in the Department of Education, and really in regards to that £6.5 million fund that we've specifically invested in schools jointly for that mental health support programme, because we do know we need to do that intervention. We need to make sure that the support services are there as well. In regards to the eating disorders and leader of that piece of work we have, I'm trying to find it here in front of me. Apologies, I can't get the specific update on it, but it is a response. Tomas, can you cover that when I come off? Just in regards, if I can't get it to hand here, just Paula. I know I have it in here in this bag, but it is about the balance of being able to provide those supports, not just for, as you rightly indicate, those undereating, but also overeating as well, and the challenges that comes as well, and the supports that we can give to young people and their parents as well. And if we can do that through educational settings, it is more benefit, because it's getting the first door approach that we want to be able to achieve, that people can get that support when and where they are and when they need it.
Okay, thank you, Chair. Thank you, Minister.
Yeah, thank you, Paula. I'm going now to Jerry Carroll. Go ahead, Jerry, please.
Thanks, Chair. Thanks, Minister. Minister, we've heard it from yourself today. We heard it last week from officials and other ministers that the budget is bad. And it's not good enough, and going by what you've stated, won't cover the mental health pressures or services that you indicated you want to see. And I know you have an interest, obviously, in mental health. I'm not doubting that. But I'm really concerned about the budget just not being fit for purpose. And I really want to ask specifically and politically what has been done by yourself, by other executive ministers, by your officials to challenge that, because we were in and still coming out of an unprecedented period, and to have a budget which is stand still and continuing on as normal is simply unacceptable, and is a slap in the face for everybody who's been through this pandemic. So I want to know what's being done to challenge that terrible budget. Thank you.
Jerry, well, sometimes we say this, you and I are on the same page of this. I know I've been making that argument about the budget that has been supplied to health overall. As you know, we were told we were getting a flat cash budget, which in regards to us is challenging, because one of the biggest expenses that we have is staff workforce. So it leaves all the other additional, the transformation pieces, the new initiatives, the new strategies, all the more challenging. But that's why we have to make the case. And that's what setting out the action plan and the mental health strategy is about. And that's why we'll bring forward a fully costable, so that my ministerial colleagues can see what this actually costs to do. And then it's about seeing if the political will is there around the executive table and around the assembly actually to support that. Because it's easy to look to individual ministers and look to their own budgets without challenging and see what is the greater good. And that's where the programme for government should come in, about us as an executive, us as an assembly, actually coming together jointly to do that as well.
Okay, thank you. And the final indication I have then is from Alan. Go ahead, Alan, please.
Thank you, Chair. Minister, it would be great if we could provide you with a magic wand to overcome the funding shortfalls to enable you to do all that you'd like to do. But in relation to this particular issue, has your department recorded increased instances of mental health issues in the community during COVID? Has it been across all the age groups? And as we come out of the pandemic, could any of these new mental health issues begin to resolve themselves without professional intervention? Thank you.
Thanks, Alan. Yes, we are seeing, we're seeing an increase across all age groups, but we're also seeing an increase in acuity as well across many of those age groups as well. In regards to what more can we do, and not about, it's not about solving themselves. It's about us empowering individuals and us empowering community and voluntary organisations to provide those interventions. And that's why it's important we engage with the Department of Education, support them as well. That's why it's important that we work with the community and voluntary sector to empower them as well. While we come out of this pandemic, we need every able body to assist us. There are people out there who have been dedicated, who have been committing over and beyond of their own time, of their organisation's time, over the past 14 months, and it's how we now work alongside them, so that when we work through our mental health action plan and the strategy, we can actually get to a better place. I want Northern Ireland to be that role model of mental health best practice, not just across the United Kingdom or across these islands, but I want it for our people. We need that. We need the strategy. We need the action plan to set out that direction of travel. I need the support of the Assembly, of the Executive to get there, and I need the funding support as well. We've got the buy-in from the people of Northern Ireland. They know what needs done. We're setting out a roadmap and a direction in the strategy and the action plan of how we think we can get there. And that's why the consultation was specifically important to us and the feedback that we've got.
Thank you.
Okay, thank you, Minister. Just before I wrap up there, I see where Peter has joined us. Do you want to introduce Peter and then I'll come back to you, Minister?
Yes, Colin. Peter Twogood's our new Director of Mental Health, and as I said in my opening comments, it's a new position within the department. It's the first time we've had a civil servant at that level dealing specifically with mental health. So I think it shows a commitment from us that this is a genuine approach and a genuine piece of work. Chair, I apologise. I know in your comments said you asked for an earlier start. I had actually a briefing with the Chief Medical Officer prior to this meeting before I go into the Executive. So I wanted to spend more time with you on this because it's something that we've had a good working relationship, Chair, between ourselves and the committee in regards to do this, because there's a joint will and I think a joint approach that we can really make a difference here.
Okay, so thanks for that, Minister. And just before you do go, I do want to acknowledge the decision last week to not extend the children's regulations. The committee had expressed a number of concerns, and I know the sector had expressed a number of concerns around that. So I just want to acknowledge that. I think that's a good example of where consultations are carried out and then are listened to and action. So I think that's really welcome. It also came up last night actually in relation to our meeting with the young people around mental health as a key issue for them. So it was good to be able to say to them, listen, that system is going back to the system that had been in place before. Not that that's perfect, but it's certainly better than the curtailed system that had been in place throughout COVID. So listen, just thank you for this morning, Minister. Regrettable, I think, for all of us that it has been disrupted in terms of timing. This is a massive issue, I know, for you and for us and for the sector out there, and one that we really do need to get to grips with. We'll see how we get on with the officials. If there are outstanding questions, then members can maybe put those through to you.
Yeah, no, Chair. Look, there is no problem with this, and apologise. I know in our 4 weekly schedule was I was meant to be in front of you again next week in regards to the usual presentation, but as this is Mental Health Week, I thought it was useful that we actually did this today because I know that's where the committee's focus is. But as we come out of this pandemic, the more engagement we get in regards to these, the delivery of these services that we're meant to be concentrating on, the more I appreciate the engagement that we have. Sorry, Chair, and just in a final point, I've actually found the response to Paula, and just to let her know that I approved the inclusion of the policy for the eating disorder service provision across Northern Ireland, which has been examined by the Health and Social Care Board. And that policy direction is included in the final and published mental health strategy for 21-31. And it's actually at the development of a detailed business case as well in regards to eating disorders. So I leave Thomas and Peter to follow up on the detail of that, Chair. But if there are further questions, we're happy to come back and re-engage on this issue because it is a large large piece of work. And as I said, we'll be able to engage next Tuesday, I think it is, when the committee motion comes forward as well in regards to mental health. So thank you for that.
Okay, thank you, Minister, and we'll let you go. Good luck and take care in the time ahead. Okay, all the best. Okay, so I suppose I'll pick up again then, Tomas and Peter, in relation to that issue I was asking the Minister about in relation to workforce. And obviously, first of all, the key nature of having the workforce and people in place, the lead time that's involved in workforce and the planning that's involved in that. And that's why I'm disappointed in section 13 there in the workforce plan that these things are still to be scoped, timeline review to be scoped. There's very little detail in terms of, and nothing else can fall in place until the workforce is in place. So I'd like some detail on what plan is taking place in that. I also noticed a reference within that section to consideration of alternative methods of working and alternative workforce. I would like to draw out what that alternative workforce refers to and where it might exist and how it might be mobilised. So whichever of you, I'm not sure which you want to lead off on that, please.
I'm guessing that would be me, Chair. Thank you very much. Okay, so I can start with the alternative workforce first, because I think that's the easiest to answer straight away. We believe that the traditional workforce mental health is hugely important. So psychiatrists, psychologists, social workers, nurses, that's an absolute key part of our mental health workforce. There's, however, also significant other people who provide really good mental health interventions, such as counsellors, a variety of therapies, art therapy, music therapy, and so on. And those alternative workforce have often not been considered part of core mental health workforce. We want to make sure that they are considered part of core mental health workforce and to bring them in to the bigger picture of workforce planning, and when we talk about the mental health workforce. So let's make sure we use all available resources to us, not just what's traditionally been seen as the medical or the social care model of mental health, but the bigger picture. So that's what we mean by that. And we have clarified it further in our work with the mental health strategy to make it very explicit what it is we're talking about. So there's no misunderstandings here. We're not looking to undermine the existing workforce. We're looking at enhancing the workforce overall. And as you said, the workforce review is a very, very key thing. Unless we know how many people we need to do the work, it's really hard to plan ahead going forward. As you said, it takes time to plan, but it takes 7 years to train a psychiatrist. A psychologist spends 6 years at university, at least. These things are not quick fixes. But saying that, it's important we get it right. We shouldn't rush through workforce review just to have something on the books. We must be a good workforce review. I mean, to that extent, we've been working on planning what the workforce review would look like and how we can get that done. It's something we see as priority, but it's also something that I need resources to do. We can't do that in-house in the department because we need help and support from professionals and people who understand how services are delivered on the ground. And until we get that resourcing, it is very difficult for us to carry out that review. But we do see it as priority, and I would hope that there is something we can start later on this year.
Okay, well, that's disappointing, Tomas, in the sense that I know a review should be good and should be done properly and not rushed, but the problems have been known for quite some time. So I'm surprised that we're only now getting to the point of saying, let's do this properly. Surely that is disappointing, given, as you pointed out there, some of the disciplines and professions require 6 years of training. So that is a concern, and one that I think that obviously we can't go back and redo it, but it's just something that I think there's a sort of a trend whereby we're very, very good at reporting what the problems are, but actually putting specific plans in place and implementing those plans to address the problems is the bit of the picture that's not happening to the degree that many people would like. So okay, I'm going to have another. I'll come back. I'll come back maybe on further questions that when I because I'm also conscious, and I don't know how this fits in with the larger workforce review that Charlotte McArdle was doing, and I know Charlotte's Chief Nursing Officer, but that workforce review, was that simply on nursing, or was mental health not taken into account as part of that?
I can't speak on the details on Charlotte's workforce review, but I know that mental health nursing was definitely part of her review. So there has been work ongoing. We just don't have a comprehensive workforce review on mental health as a whole. we're considering how all the workforce joins together. So I mean, it's not that the work has been standing still for years. There has been work ongoing. I mean, our social work colleagues in the department are looking at social work, and in mental health services, I mean, Charlotte has been looking at mental health nursing and the need for mental health nursing going forward. But we need to bring together this comprehensive mental health workforce review, where we can see how all these professions work together as a whole and how we can resource the system going forward properly. But I mean, the disappointment that it's not been done in the past, I can only share with you. I mean, I can't say anything else, but it is frustrating.
Okay, and I will just declare my own interest as having worked as a social worker, including within the crisis response teams. But it is deeply frustrating, and it's something as a matter of urgency now. We have to start recruiting these workforce and get them in place, or we're, a 10-year strategy, we're going to be more than halfway through that strategy before we have the right people in place if we don't start to action that. Okay, I'm going to go across to members then. So I'm going to go to Pam first of all, then Paula Bradshaw, then Cara Hunter. So go ahead, Pam, please.
Thank you, Chair, and thank you, panel. I'm just wondering if you can tell us a bit more about the mental health strategy going forward and what role technology will have within that strategy. I'm thinking in particular of the Encompass programme and the real issue that you have around different computerised systems within trusts and different kind of actions in relation to coding and actually gathering the data that you require.
Thank you very much. I mean, we all know the frustrations of having different computer systems across the trust, and that's something that we all share, I believe. Encompass will certainly help this mental health. It will help us to have comparative shareable information between both community mental health services and inpatient mental health services and across the trusts. To have good understandable data and good outcomes measurements, it's really important to understand how we can assess what we're doing and how we can do that better. That is specifically mentioned in the strategy as one of the actions to have a clear outcomes framework. That hinges on having a data system that works across trust and a work within trusts, when Encompass will help us to do that. I just want to make it very clear that is not the only thing we're doing when it comes to technology and mental health. We're also looking at how we can help technology, or how technology can help and support professionals doing the work more effectively. And that is by being able to share data easily, and Encompass will help us to do that when a patient moves between trusts, which is very common in mental health, as we all know. But it also includes developing, for example, online CBT or other similar online treatment methods, not in replacement of existing methods, but as an additional support for people where this would be helpful. So that all these technology and these online methods will help us, for a better, more responsive service as a whole.
If I could add to that as well, I think that the key thing is finding how ways of working better and digitally complements the face-to-face working, and that came through in the consultation as well. That's just to emphasise what Thomas said there, that this isn't about replacing face-to-face intervention, it's about complementing, adding to and improving, and there are specific refinements that we're proposing to make in the final strategy that would reflect that. But it's really about building on a lot of the good stuff that's happened over the past year that has been forced on us as part of the pandemic. Trying to develop that further and exploit its full potential in a more normal operating context.
Appreciate that. Thank you. I think we do absolutely need a balance in going forward from pre and post pandemic and how things operate, and it's good to take the good bits that have worked well and build upon that and use. But I would like to see this provision being rolled out and rolled out as quickly as physically possible. Have you any comment around GP access or GP provision of talking therapies? To any update on that to give us this morning?
Yeah, talking therapies or counselling or other therapies as mental health support for GPs, that is an absolute vital part of GPs to be able to provide mental health support, especially step 1 and step 2 in a step care model. Counselling services are available at many GPs, but not all GPs, and I know work is on the way at the moment in the Health Social Care Board to try to encourage further uptake of counselling services. Similarly, we have token therapy hubs. They are currently run by the trusts. One of the actions in the Mental Health Action Plan is to shift the focus of token therapy hubs towards primary care, so it becomes part of the toolkit of GPs in their delivery of mental health services. This will go hand in hand with the development and rollout of further mental health workers in the primary care MDTs, which is all about helping people getting quick access to mental health services when they need it, where they need it. Some of these things are not easy, and because it requires structural change, and it's something we're working on, it's something we're actively working on at the moment to make sure that is available to GPs at high numbers.
That's great. Thank you, Colin. Just if I may just come back briefly on that, just want to reiterate the importance of that physical GP access in the first place to access any of the services that are available. And obviously, that there are great difficulties because it's not streamlined across the board, across GPs, and some people, especially people maybe with mental health issues, will have even greater difficulty actually getting in contact with their GP, let alone seeing them. So I hope there is some more going on in terms of addressing those particular issues around access to GPs. Thank you.
Thank you, Pam. Going into Paula. Go ahead, Paula, please.
Thank you, Chair. Just a request of Thomas, if he can, in slower time, tell me what the Minister reported there in terms of this policy direction, a wee bit more detail around that, and then I have a separate question for Peter. Thank you.
Yeah, so we, the Health Care Board had worked on an review of eating disorders for us, together with the Regional Eating Disorder Network Group, which consists of service users, clinicians, carers, community vulnerable sector, and trust and board representatives. So they come up with a service proposal for a way forward, which would enhance mental health or eating disorder services across Northern Ireland. So additional medical, nursing, dietetic, psychology, and occupational therapy and social work staff. It will provide in-reach from community work into inpatient settings where we have mental health eating disorder patients in mental health wards. And it will also expand use of other therapies and other adult health profession interventions in eating disorder services. That's a very short summary of a large paper, but it provides a number of options that we have recommended for, or the Minister has approved for future policy direction. That this will massively improve eating disorder services will ensure that we're compliant with NICE guidelines and similar. It will also make sure that we can provide good pathways for all people with eating disorders. Exactly how those services are developed, how delivered, must obviously depend on what's best clinical outcomes. But it will cover all kinds of eating disorders. So we have asked the board to develop a detailed business case for us so we can consider funding for that, which obviously we have through this part of the process. And the mental health strategy will reflect the work of the Regional Eating Disorder Network Group, which has done really fantastic work to produce that for us.
Thank you. Thomas, I appreciate it's still in sort of draft and development format, but at what stage can we as a committee get a more substantive paper on that? Will it be whenever the Minister signed off, or is there anything we can get in advance of that in terms of the thinking? Plenty of brilliant stuff going on there. It's just a number of constituents who are very keen to feed into this, and they'll be delighted to hear that this is the sort of direction of travel.
I am sure we can provide something in writing to you in more detail now. If the committee writes to the department, I'm sure we can provide it in writing, as long as you give me a few days to summarise all that for you. That's not a problem.
Oh, brilliant. Thank you so much. My question is, I think it's to Peter. You mentioned there about the length of time it takes for people to become specialists, and an area where I'm particularly concerned about are those people who are victims and survivors, not just of the troubles, but also from the mother and baby homes. Who've had forced adoption, children taken away from them, historical clerical child sex abuse in terms of, say, sexual abuse, and others who require a very, very intricate conversation with somebody who really understands what they've been through and the support they need. I'm just wondering, do you feel that there are enough of those specialists in Northern Ireland? If not, what is being done to be able to put those people in place? Thank you.
Paula, if you don't mind, I'll probably defer to Thomas again for a substantive response on that. I'm still very much reading into the brief. I'm not long in post, so I wouldn't want to give you some incorrect information. Thomas, is that something you could respond to?
Absolutely. We have a really good dedicated workforce for those areas in Northern Ireland. We have really good staff to carrying out really good work, both in the statutory sector and the community development sector. And that I don't want to take away from anything of that. But I think it's accepted that we need more. In the levels of people with trauma-related mental health problems in Northern Ireland are significant, whatever that trauma is. And we need to make sure that we have a workforce that is trauma-informed and that is an expert in how to help people with that kind of trauma. There is some work in some recommendations in the strategy around research and about helping Northern Ireland become better at doing those things and pulling that together. That will help ensure that we have the right training for people. So it's an ongoing issue. Very important to say that people who have severe needs can definitely get the help and support they need in Northern Ireland. That support is there. No one will be turned away if they have severe needs. And there are specialists for those people. So I would want to be very, very clear. We shouldn't scare people away from seeking help.
Okay, thank you very much. And again, if we can be kept up to date with that sort of policy review that you mentioned there, Thomas, really appreciate it. Thank you very much, panel.
Thank you, Paula. So now I have in the following order, now I'm going to Ciara, then Arlea, and then Carol. So Ciara, go ahead, please.
Thank you, Chair, and thank you, panel. My question refers to last night we had a fantastic conversation with young people about barriers to access mental health support and how we can improve them. And one thing that was mentioned was if you live in a rural area, how it is that bit more difficult to get counselling and to get access to medication. So just off the back of that, can I ask what conversations or engagements the department is having with groups like the Rural Community Network to identify need and the impact in these kind of rural areas? Because I do note within my own constituency, we've had conversations with constituents in areas like kind of rural Limavady Park area, and it really is difficult. If you don't have access to a car, for example, getting access to your GP can be difficult. And there's fears as we move more towards utilising technology to get in contact with our GPs. Rural communities are being left behind due to broadband issues. So just any clarity on that I'd find extremely helpful. Thank you.
Yeah, first I can say that access to mental health services should not depend on where you live. That is something that's we're very, very clear on. We want to have an equity of service across Northern Ireland with local service delivery. That means that it is delivered differently depending on the setting, so it matches the need of the population. That is an absolute key thing for us going forward. We have engaged quite extensively with a large number of people over the last 18 months, 2 years about the Mental Health Action Plan and about the mental health strategy. That includes groups from rural communities. And I met with a number of them personally, and they've taken part in our reference group work and in our co-production work, both with mental health strategy and action plan. So those who have been considered, we're very aware of them, and it's something we definitely need to work on going forward. That we reflect that in the practical outcomings of the strategy.
Thank you, Tomas. And just off the back of that, is there any kind of innovative initiatives you're looking at, such as social prescribing, to engage with people in rural communities? And I welcome your comments, because sometimes people in rural communities can be left behind, and it's good to hear that their first-hand comments and opinions have been included. Thank you.
So sort of prescribing is a great thing, and it's very helpful to people, especially on step 1 and step 2 on the step care model, or people need support even prior to that. And that's not something that's just for rural communities, that is across the board. It will look differently in urban and rural settings, but it's something that needs to be available across the board. We really want to make sure services are catering for the communities. There might be that a service in central Belfast might involve a drop-in centre. In the rural community, that would not be practicable. They would probably mean people have to travel to, as our professionals have to travel to people who need the help. So it's building that in the service delivery and the service implementation in the details from the very beginning. So that doesn't become an afterthought, but that is part of the delivery of the service model in the first place. So we're putting that those kind of consideration as a requirement when we're developing the services coming forward out of mental health strategy. So that's how we're trying to ensure that balance is not lost.
Thank you.
Okay. Thank you, Cara. And going across to Orlia then. Go right. Orlia Littlehull.
Yeah, Gormy of it, Colin. Thomas, maybe just the first question to yourself. The Minister had referenced there in his briefing around the crisis review, and that's with I'm assuming that's the Minister now to consider the recommendations out of that review. So I know the intention was to have it published by April. That was in response to an Assembly question I put in a couple of months ago. So I'm just wondering, have you a timeline, Thomas, as to when we will be able to, see the findings and the recommendations of that review?
Yeah, the review was received in the department a few weeks ago, and it is still currently sitting with me. The delay is purely on me, so blame me here, not Minister. I'm working my way through this as quickly as possible. It's a very comprehensive review, more comprehensive than we anticipated, which is obviously a brilliant thing. Yeah. But it's taken me a little bit longer to make sure we can provide accurate commentary around that review to Minister. My hope, barring any unforeseen circumstances, is to get it up to Minister shortly. So with scope time from weeks rather than months. But I don't want to promise a date, considering that we're all under significant pressures and working very hard.
No, that's no problem, Thomas, and that's actually, I'm glad to hear that it is more comprehensive than you expected, because as you said, you would rather that's a good thing. So I know I'm due to meet with the Minister when you have completed the substance use consultation responses. He's agreed to hold a meeting with me, so hopefully that might chime then the same time with the crisis review, and we can get a fuller conversation on both of those issues. And then just secondly, Thomas, I know that you and I spoke about this at one of the previous mental health APGs, I think it was, and it was around I had put it into the Minister about the department carrying out a food needs analysis for poor mental health crisis, and drug and alcohol addiction. So I know that the Minister obviously did reference the prevalence study that was carried out around the children and young people. But he did say to me, and this was again in response to an Assembly question that was last year in October, that under the Mental Health Action Plan, Action 15.2 calls for a prevalence study for adults. So is that something that's maybe being carried out by the department, or has been done, or have you any update on that?
We've not carried out the prevalence study among adults, and we have been looking at that last year. It's something that's been on my desk quite a bit. We at this point struggle to get value for money for that kind of study. We have significant amount of academic research showing us of the needs in adult mental health, and across substance use and the issue of dual diagnosis as well. And we believe that it already exists provides us with a fairly good indication of need. And we think that the cost to develop a prevalence study for adult mental health could better be used in providing the services, as we have more academic research among adults that doesn't exist, which didn't exist in the same extent among children. Yeah. So there's a slight different need. Also, the children's prevalence study gives a good indication on, it gives a very good evidence about the prevalence among children, and much of this carried on into adults. So it gives us a good basis to work on. So at this point, we're not progressing a prevalence study for adults simply because we have the information in other areas, and we can use the money better to deliver services. It's still something that's a consideration going forward. If we think that would help us, I would definitely put that proposal forward. At this point, I'm not sure it would, considering the cost involved of doing that.
Okay, that's fair enough, Thomas. Thanks for that update. And then maybe just finally to Peter. So it's nice to meet you, Peter, via Starleaf anyway for the moment. But maybe just Peter, so in your own role, because I'm conscious that the Minister says that this is obviously a new post that you've taken up as Director of Mental Health. So could you maybe just explain a wee bit more around, what your role is, or, who you'll be engaging with, and, what really your position entails? And I would love to organise a separate meeting outside of the committee just to get chatting with you in a bit more detail around all of that as well.
Yes, Olia, no problem at all. Yes, I'm delighted to be here, and I'd be delighted to have a chat with you about this. Yes, it's a newly created role, and it covers all aspects of mental health. Well, that's adults, children, and implementation of the Mental Capacity Act as well. Also, domestic violence, sexual violence aspects, as it falls within the DOH remit, falls under me as well. So I have four strands of my remit at the moment. I'll be honest, I'm genuinely excited about getting stuck into the role. I was in the Department of Health a number of years ago, albeit in a different capacity, and I've spent the last 4 or 5 years in PEO, the last year of which working on COVID-related matters and the executive response to that. So really seeing through that work the importance of mental health and the emerging issues that need to be resolved. And I'm personally passionate about making things happen. I'm not one for talking. I want to see things happen on the ground. So hopefully that aligns with yourselves on the committee. My background is I have a strong finance background, so very keen and acute to the challenges around health funding. But I will be looking at any way possible to get money into the mental health arena and to try and be as innovative and as imaginative as possible in that regard. What I am, I suppose, struck with, I mean, I'm only in post a couple of weeks, but it's the need just to join everything up across government. And we've talked about that already in terms there's so many determinants and so many features that impact on mental health across many different departments. And again, just through my previous role, I've made some really good contacts across government departments, and I want to exploit that in the current role in terms of making sure we're all joined up. And again, that seems to be actually strongly in the consultation, the draft mental health strategy, the need to be better joined up across government, and that's certainly something that I'd like to give priority to make sure. I suppose I've already had this conversation many times in the past couple of weeks with Thomas. To me, it's just said and done, but it's so important. It's about seeing everything through the patient or the citizen perspective, not through the system, not through an organisation. That is challenging, and I've already seen challenges in that regard. But that's certainly something that I would like to embed as we go forward and sort of try and put forward. So, Orlia, delighted to meet you. Delighted to have a chat with you outside this as to how we take things forward as well.
No, that's brilliant, Peter, and wish you all the best in your new role. Hopefully it'll go a long way to achieving that parity between mental and physical health. So wish you all the best. Thank you.
Thank you so much. Thanks.
Thank you. Thank you, Orlia. And it is good, Peter. It is good to meet you there, as Orlia said, and also good to see that sense of commitment to the role does come across, which will be useful. I think it's also interesting just a wee around that the need to involve the individual and the citizen, absolutely, but actually also there's a strong potential within community as well, and the need to involve communities and as well as individuals within the community. So that's all interesting stuff for the future. I suppose it's interesting considerations. So I'm going to go now to Carol. Go ahead, Carol, please.
Okay, Caroline, thank you, and thank you to Thomas and Peter, and welcome you, Peter, to your new role. And just to repeat what other members have said, it's very important, to give the status of mental health through a post like yourselves. Thomas, you in some commentary said that the department were keen that GPs also took on board through primary care the talking therapies. I just want to clarify that's in addition to the talking therapies within the community and voluntary sector. And you will be aware of a campaign, like 123 campaign about getting GPs better equipped to deal with mental health problems. So that's my first question. The second question is in relation to the care pathways and indeed the Children's Commission's report still waiting into mental health services. So it's just because it's something, first of all, it is alarming, but not surprising at the length of time it takes to fill these much needed posts. But certainly the indications from my own constituency work or that their CAMS and indeed at modern mental health services, the demand for them has increased. So it's just to try and get a sense of those. And my last question is in relation to when the Health and Social Care Board is dissolved. Peter, will you be sitting on any new management arrangements to ensure that mental health is given the same status and priority across all trust areas? Because at the minute, each of us feel that it is a bit of a postcode lottery, and I accept that no one wants that to be the case. So again, they're my questions, so thank you.
Yeah. In terms of GPs and counselling, I mean, counselling is absolutely key in GPs. I can have much sympathy for the 1 to 3 GP campaign. We need to ensure that GPs are equipped to deal with mental health problems. When it comes to the talking therapist hubs, or hubs that are currently funded by the trust, and often delivered by the community vulnerable sector through contracts, what we want to get to is a stronger working between the GPs and community vulnerable sector. That there shouldn't be an enemy here. There should be opposition. There should be a partner in the delivery of this, both in the really good voluntary work they do, but also through the statutory funding that comes through the talking therapy hubs. So this is an additional resource for GPs, or maybe rather putting the resource exist through the most appropriate place, so it's more easily accessed. So this is not in competition to the community vulnerable sector, it's in together with the community vulnerable sector. They should enhance the overall provisions rather than take anything away from anyone else. So I mean, sorry if I wasn't clear enough earlier on. I want to make it very, very clear that community vulnerable sector is partner in the delivery of this, and that's absolutely key. When it comes to increasing staff and post and the Nikki still waiting plan, we know the challenges. I mean, I'm not shying away from that. We need to do everything we can to ensure the workforce is available, that posts are attractive, that we have the right banding level, so therefore posts will be interested. And that's something we're working actively with the board and the trust to make sure that's the case. I mean, I can even go and give you assurance that we're doing the very best we can. But it is difficult, in particular in some areas of Northern Ireland. It is particularly difficult to get staff to fill posts. I mean, the West is a very good example. We have a lot of vacancies in the West, and it's not because they're not trying really, really hard in Western Trust. It is just we don't have a workforce that's big enough. And I mean, that brings back to the need for workforce review. We need to have that in place, so we know how many staff we need to train, how we can incent them coming from other jurisdictions, and so on. So, but that is work that is ongoing.
I'm sure in relation to the question about the Health and Social Care Board.
Sure, Carol, you're right. But whenever that organisation ceases to exist, a lot of the key personnel will still exist, and certainly one of the key focuses that I've had over the past couple of weeks is just starting to develop those relationships, certainly with Brendan Whittle, who's the new Director of Mental Health in the board, and who's recently taken up post to ensure that we're on the same page, or certainly where I understand exactly what's going on there as well. But you can be assured that yes, I will be an advocate internally in the Department for Mental Health in terms of making sure that it's I suppose prominence is there, and again developing those relationships internally with those key senior folk in the department. Karen Gallagher and co, who will obviously is in post at the moment and will retain responsibility for the board, just developing that relationship and understanding, so that they understand exactly where we're coming from in the most possible way, that it'll maximise every effort that we can get funding resource into this area.
Okay. All right, Carol? Yeah. Okay, thank you. I suppose actually just one, maybe it might be Tomas, I'm not sure which of you maybe could deal with this, but in relation to gambling addiction services, and I was taken aback a number of years ago, prior to COVID-19, an event in the Long Gallery had identified that 1 in 10, I think, and possibly higher, of suicides are linked to gambling addiction. So are there any commissioned gambling addiction services, and any plans to develop those further, Tomas or Peter?
Peter, I don't know if you want to answer, if I should answer here, but there are no specific gambling addiction services. all trusts have generic addiction services that deals with addictions of various kinds, which includes people with gambling addiction. Gambling addiction is a very serious thing, and I'm not in any way trying to minimize gambling addiction, but it's important we distinguish between addiction related to gambling and problem gambling, because they're fundamentally different sources and different reasons, and how you deal with them are different. People who have gambling addiction should very rightly receive appropriate addiction services, which you do provide. We don't have any statistics on gambling addiction across services, or is there services for people with gambling addiction in Northern Ireland? And that is something I know that the committee has highlighted to us in the past as something that we could improve on. But I mean, there are services available for those who have gambling addiction. When it comes to problem gambling, we have to look at what causes the problem gambling. That is often not an addiction, but it has to do with the social determinants that sits behind gambling, and that is something that also needs to be considered when gambling is considered society as a whole. So if people are gambling because they have financial problems, that is probably not the mental health or addiction response. It is more how we cope with difficult financial situations, and it's kind of a fine line between those two. But it's important we don't put people into mental health services or addiction services that don't need that help and support, because that will not help them. So it's about getting the right response to the service without in any way minimizing the impact gambling has on people.
So for the ones that do, in your argument, Tomas, what services are commissioned in that respect?
There are generic addiction services in all trusts within mental health services that will help and support those with addictions. They're not specific on gambling, but exist for people with any addiction, and people with gambling addiction will be treated in those services. On top of that, of course, mental health services, people who struggle with addiction that leads to mental ill health, mental health services will provide help and support for those people. And we know there's a lot of people in our generic mental or in our mental health services that where addiction is the cause of their mental ill health, that's being provided help and support.
Yeah, and indeed, I have worked with addictions as part of my role as a social worker, and I have to say, I recognise what you're saying, and actually those comorbidities of addiction and mental health issues, and indeed physical health issues, the lack of addiction services are then often used as or become a barrier to the other services. So if the addiction is not addressed, the mental health access is not available. So I think it's fundamental, and I'm not sure gambling is quite a specific one. I'm not entirely convinced that a generic service is meeting the needs best in relation to that. So that might be something that's worth considering. I think it's a major and a growing issue, and has become a growing issue over the pandemic, alongside a host of other physical and mental health issues. But I think that's something that maybe would merit a further look. And I see Peter noting that. Peter, do you have anything there in relation to that issue?
I have nothing further to add, Chair, to that, to what Thomas has said. It's something else that we need to be aware of and consider.
Okay. So thank you very much, gentlemen, for joining our meeting this morning and for taking questions from members there. And also, I know that there's a commitment to forward some specific pieces of information, which the committee look forward to receiving. But for now, good morning and thank you for attending.
Thank you.
That's good. Thank you.
Okay, members, I'm going to take a short break there then before we go back to our substantive meeting. So I will 10:58 now. Could we come back at 11:10? 10 past 11 to resume. Thank you, members. Let's see then. And Clerk, could you take us out of broadcasting?
Sorry, Chair, just wait a confirmation. That's us live now.
Okay, thank you, members, and we will now resume our meeting this morning. So, members, first of all, in terms of chairperson's business, I wanted to just reflect on the fact that obviously we're putting a particular focus on mental health and mental health issues this week, and have arranged a significant programme of engagement with a number of groups across the week. And I think that's a really useful focus for us all. We did yesterday meet with the Mental Health Policy Group, which is made up of members of the Royal College of Psychiatry, Inspire, and Action Mental Health. I thought it was a really useful engagement in terms of people who are very, very acutely aware of the current issues and also potentially some of the solutions to some of those. But do members who are at the meeting want to make any comments in relation to that one? I'll go on to the meeting with the young people secondly, but for now, just in terms of the mental health policy group, does anyone want to make any comment?
Chair, can I come in?
Go ahead, Paula, please. Yeah.
Chair, I had to leave the meeting after an hour, but I found it really fascinating. I suppose there was nothing really new in it, but it was very well put together by the groups who came together. I suppose it's something we do have to continue to work at, because there was so much information there yesterday, and it's good that we focused on it today. But going forward, once we come through the pandemic, we need to keep coming back to this issue.
Yeah, thank you. Yeah, I thought so too. It was a really good pulling together of a lot of the issues. It was really useful in that sense, and I think set the week up very, very well in that respect. The other meeting then that we did yesterday evening was with a group of young people who VOIPIC, Nikki and Youth Action, among others, had facilitated that, and the Assembly Outreach team and the clerk. A really, really good engagement as well. I want to thank all of those people for organising it. I specifically want to thank the young people who contributed across a couple of hours with us, a very focused and a very personal session, but also the fact that they in themselves are clearly experts by experience and were able to give us that perspective, I thought was really, really useful. And I want to thank from that group last night, Deirdre, Destiny, Aoife, the two Lees, Ciara, Orla, Jamie, Dara, Troy, Niall and Kaelan, who was facilitating a group of those young people. So I thought it was a really, really good session, I have to say, and some fantastic comments, some fantastic ideas coming out of it. So again, do members want to make any comment on that session last night?
Chair.
Go ahead, Pam. Yeah.
Chair, yes, just to say, huge thank you to the young people in particular and everybody else who gave us their time last night. And it was very interesting to hear the different views from the young people and see how different those views actually were on some of the issues. So I thought it was very worthwhile, and just huge thanks to those young people for giving us their time and their thoughts on what has been a really pretty traumatic year, I think, for a lot of people. So that's good.
Yeah. Thank you. Thank you for that, Pam. So moving on then, Dementia Action Week, at tab 7.11 of this week's pack members, there's correspondence from the Alzheimer's Society highlighting the fact that next week is Dementia Action Week. Members will have received that individually as well, and I would outline that there's a series of Zoom sessions being organised by the Alzheimer's Society next week, which members may want or may be able to avail of. That'll be quite useful. Also, just to reflect on the autism motion, I think it was useful focus in terms of, and very, very clear cross-party recognition of the difficulties that people who are struggling with autism services are present. We're all acutely conscious of the COVID element of that. But I just want to reflect, I think it was a useful debate. It certainly doesn't solve anything in itself, but it puts a focus on what we need to do, and I think we do need to keep a focus on this. I know, Pam, you're actively involved and brought an amendment to that as well. Do you want to make any comment on that, Pam?
Yes, Chair, thank you. No, I thought it was a good debate too, and probably quite timely in relation to the private members bill, which is in my name, but that's obviously because I'm the chair of the all-party group on autism. But obviously that is a private members bill which is supported by all parties, and thank you for everybody who's involved in that. So I think it's leading up nicely to the introduction of this private members bill, which we're hoping to see in the very near future. It's progressing very well with the drafters. So I think it will be a good piece of legislation going forward, and hopefully will really strengthen the Autism Act, which is what we need in order to ensure that what was put in place back in 2011 in terms of the Autism Act, it actually becomes a reality for people on the ground. I think it's really important.
Yeah. Thank you. Any other comment there from members on that before I No, okay, thank you. And finally then, just in relation to chairperson business today, I was looking to just highlight the fact that I mentioned to the Minister at the end, the fact that as of last Friday, the emergency regulations around children's visiting and social work and support had the department had decided to revisit their decision to extend those. I think there was clearly concerns that the committee had engaged with across the sector, and I think that's very much to be welcomed. The fact of the decision, but also the fact that the department responded to what was clearly widespread, significant, and appropriate concerns. So, any other comments from members in relation to that? I think members in broad agreement. So, okay, thank you, members. So, moving through then with draft minutes. I refer you to draft minutes of the meeting of the 6th of May, which are tab 3.1. Are members content with those minutes? Yeah, thank you, members. And there are no matters arising from those. So we can move now to our mental health, a second briefing during our Mental Health Awareness Week focus. And the second briefing this morning is from the Children's Commissioner and the interim mental health champion. I refer you members there to papers at tab 6 of your pack and to the briefing paper at tab 6.4 of the table papers. So I would now like to welcome, and I think we have everyone online, but I'll just check with Clerk. Do we have Koulla online?
We do indeed, Chair. Both the Commissioner and the Mental Health Champion are on call.
Okay, I had seen Siobhan's name there, but I see Koulla now as well. Thank you. So, first of all, I'd like to welcome Koulla Yiasouma, and Koulla is the Commissioner for Children and Young People. Good morning again, Koulla. Welcome back to committee. How are you, and can you hear us okay?
Yes, good morning, Chair. Thank you very much. And yes, I can hear you very well, thank you. There's a little bit of feedback, but yes, I can hear you.
Yeah, and I'm picking up on the feedback as well. If I could just ask all members to check that everyone is on mute who is not contributing at a given time, and also if everyone has access to a headset, that's usually better. So hopefully we can get that feedback issue identified there. And then very pleased to welcome again back to our committee is Professor Siobhan O'Neill. And Professor O'Neill is the interim mental health champion. Good morning, Siobhan. Are you able to hear us okay?
Good morning, Colm, and everyone. Yes, I can hear you all really well, and it's a pleasure to be here again on this lovely morning.
Yeah, I do see nice sunshine coming in the pictures there, which is always a help. So I'll just hand over now to the two of yourselves. I'm not sure how you want to proceed there with doing the briefing, but if you want to give us your briefings, your updates, and then we'll maybe get some questions and answers from members and yourselves. If that's okay.
Okay. Siobhan, will I go first? Yeah, okay. Just to demonstrate that we are a team this morning and really delighted to be so. So I just want to, because I'm aware this is the first time I've been before you since February of last year. So I do have some opening remarks, brief opening remarks for you, Chair, if that's okay. Bearing in mind, like as you've already said, the week that we're in, and as we emerge from the pandemic, we've been asked to brief you around children's mental health and wellbeing and the pandemic, and obviously we'll go a little bit broader than that. But there can be no doubt that the pandemic has had a significant impact on our children and young people, and not least, of course, their mental health and wellbeing. The closure of schools, academic uncertainty, having lost less contact with their friends, the disruption of routine, together with concerns about contracting the virus and also the health and well-being of their family members, are all likely to have either created or exacerbated existing mental health issues for many of our children. It's also critical that the impact of the pandemic is understood with regards to parental mental health and how that affects infants and young children's well-being, and that we can know what is called baby blind spots in the planning and delivery of policies and support for all our children and young people. But before I talk more generally, it's important to recognise the impact that the pandemic has had on remote learning and school closure on children's broader well-being. During the pandemic, we've come to appreciate the significant role that our schools have in keeping a child who lives in a family which may become vulnerable, to keep that child safe and well and out of the formal child protection and children in need system. And we await to see the evidence that the engagement with these families, we wait to see evidence with regards to the quality of engagement with vulnerable families during this second lockdown. Moving on to school restart. One young person described it as so much stress and not a lot of enjoyment. And restart has not been as we would have hoped for many of our children and young people, particularly with the perception of a reneging on the commitment to focus on their emotional well-being. There have been unacceptable pressures placed on GCSE, AS and A-level students, and in some cases, those P6 who intend to take the transfer test. We really do need to reflect on how we could have done things differently, because clearly the way we did them was nowhere near good enough. Before the onset of COVID-19, the mental health care system in Northern Ireland was under pressure and in need of urgent reform to respond to the scale and complexity of need. I was able to listen to the conversation you had earlier with the Minister in the department. And this was the overarching finding of our review into mental health services, Still Waiting, which was published in 2018. And it continues to be our assessment that sufficient progress has not been made, particularly in relation to provisions for children and young people with additional needs, those with a learning disability, those who use substances, particularly drugs and alcohol. And again, I note some of the discussions you had earlier. There's also disappointment with regards to progress, which to a certain degree and to a large degree stems from the fact that there is a lack of measurement of tangible success. Process markers such as CALM's waiting lists, attendance at appointments and prescribing rates are useful as key performance indicators, but critically, they don't tell us if children and young people's mental health and well-being are improved after receiving support. And surely that has to be the primary goal and purpose of these services. The pre-COVID statistics indicate a worrying situation with respect to waiting times and access to support. The CALM's 9-week waiting breach data between April 2020 and November 2020 has decreased considerably, and we've seen a slight increase since then. This data is confusing as it does not appear to reflect experiences that have been shared with us by young people and their families who have expressed frustration at not being able to access timely support. And this is an example of a need for further and to delve deeper into the overall referral rates, acceptance rates, and number of active clients across the health and social care trusts. And we need to have a better understanding of the changes and the way the services have changed during the pandemic. Again, I know that your earlier discussion with regards to investment, and I'm not going to rehearse the debate about the chronic underinvestment in children's mental health services in Northern Ireland. And whilst I welcome our system's commitment to raise the spend from 7.4% to 10% of the mental health budget, I'm not really sure that there's evidence to indicate that this is the right aspiration. Surely, before we decide how much is needed, we must first understand the effectiveness and efficacy of the money that we are spending, and then scope what is required and decide how much more money is necessary, rather than simply benchmarking what is happening on spend in other jurisdictions when we know those jurisdictions underinvest. Because I could predict quite easily it's going to be more than 10%. So there's been several significant policy and strategy developments over the last year which have focused on children and young people's mental health and emotional well-being. And these include, and I'm going to list them because it's important to understand how crowded this landscape is. Some of these include our own Still Waiting Action Plan, the Mental Health Action Plan, the pending substance use strategy, the Emotional Health and Wellbeing in Education Framework, the Children and Young People's Emotional Health and Wellbeing Services Framework. As you can see, it's becoming quite crowded and a possibly confusing landscape, and some work needs to be undertaken under the umbrella of the pending mental health strategy to ensure an integrated and coherent set of actions, and one that takes a holistic approach to need. And additionally, there needs to be really clear connections to the children and young people strategy. And all of that just demonstrates how critical it is for us to have a holistic approach to our children's mental health and the critical role that our education system has in the well-being of our children. A lot of the mental health issues caused by the pandemic and beyond can be addressed if effective partnership exists across all sectors and systems, and that children and young people get early services, particularly in generic settings such as education. Therefore, I would ask that this committee considers a piece of joint working with the Education Committee so that the scrutiny of government remains consistent. I do want to quickly mention mental health legislation, and particularly the Mental Capacity Act. And as you'll be aware, that this is a significant legislative development that fuses mental capacity and mental health law for those aged 16 and over. And this is the issue. It denies young people under 16 access to protections and safeguards under the Act. And there still do remain some issues with regards to 16 and 17-year-olds, although I hope a recent Supreme Court judgment may have resolved that. Also, we still don't know when the Mental Health Order of 1986, which will remain as a primary piece of legislation for under 16s, is going to be reviewed and updated in order to ensure it complies with key human rights requirements. I was really pleased to hear how well your engagement with young people went yesterday evening, and I'm glad that and delighted that the committee did that, because I do want to say that engagement with young people by our government has been wholly unsatisfactory during the pandemic. And we have seen young people take to social media to make sure that their voices are aired and heard, and they have been spectacular in doing that. But there continues to be a need for government at all levels to develop mechanisms to meaningfully engage and consult with children and young people. I can't tell you how pleased I am by the plans for a Northern Ireland Youth Assembly, because I really do believe it's a progressive step. And what I'm really looking forward to hearing about is how this committee, based on what you heard yesterday, how you will continue to work with young people and embed them into your work. So you'll be pleased to know I'm coming to an end. So in conclusion, the pandemic will have intensified existing health inequalities, again, as you've heard, and it's really important that we fully understand what this means for the lives of our children so that we can ensure that steps are taken to meet their needs in both the immediate and longer term. And to that end, my office will in the summer publish a report on the impact of COVID-19 on our children and young people across a range of issues and make clear recommendations as to the way forward. I do want to say, and I'm glad that some of the committee recognised the passion of our current minister with regards to mental health and wellbeing. And there has been a significant shift in attitudes and commitment to improve the mental health and wellbeing of our infants, our children and our young people. However, it's the achieving of that change in a sustainable way that remains our biggest challenge. Thank you, Chair.
Thank you, Koulla. Thank you for that. And to go then across to Siobhan. Siobhan, do you want to give us a few opening remarks?
Yes, please. I've got some remarks here. So thank you so much for this opportunity to provide evidence again. And I also want to take this chance to thank the Department of Health for their engagement over recent months. I want to focus today on the draft mental health strategy, and particularly the actions that impact on the mental health of children and young people. So prior to the pandemic, 1 in 8 of our young people had a mood or anxiety disorder. And as usual, our young people have a higher rate of mental health problems and emotional difficulties than the regions, and that's about 25% higher than other parts of the UK. The restrictions that were necessary to control the pandemic, particularly the school closures, will have led to a further increase. We are talking here about suffering that is preventable and treatable, and this is something that we need to address very urgently. Action 1 in the strategy is a plan for promoting mental health through early intervention and prevention. This plan must be a cross-departmental plan and should emphasise primary prevention. So primary prevention means stopping mental health problems before they occur. In other words, a whole society, whole system approach to foster resilience and to address risk and protective factors. The 2010 Marmont Review, The Fair Society, Healthy Lives, is a guide to what we need to do. And this is about giving every child the best start in life, enabling young people and adults to maximise their capabilities and have control over their lives, fair employment, good work, a healthy standard of living, and healthy and sustainable communities. Childhood adversities are the main preventable risk factors for mental illness across the lifespan. Therefore, this action plan needs to include a plan to reduce childhood adversities. The recent prevalence study, which we need to be using to plan our mental health and other services, shows us that 48% of our young people suffered adversities. Now, not all adversities have a negative impact, but adversities like parental mental illness, which is 10.7%, emotional neglect, 5.7%, domestic violence, 4.4%, they increase the risk of illness in later life, and they are avoidable. The research and data are crucial, and we need continued surveillance of adversities and mental illness in children and young people. And that means more psychiatric prevalence studies to measure the changes over time. That's how we're going to know that this part of the strategy has been effective. The reduction of mental health inequalities needs to be a core principle of the strategy because of the strong associations between mental health and deprivation in Northern Ireland and the high rates of mental illness in marginalised groups here. That means improving access to a choice of services and support services through schools, community and voluntary sector, and through the expanded talking therapy hubs. And in recognition of the relational factors that strongly influence young people's mental health, these hubs need to include a range of therapies such as family psychotherapy and play therapy. The action needs to drive a conversation across society about what mental illness is and what it isn't. And we need to co-design a shared understanding, a definition of mental health, illness and recovery that we could then draw upon and use whenever we're planning, whenever we're having public conversations. We must raise awareness and understanding of the importance of the early years, infant attachment and early relationships in developing the coping, emotional regulation and problem-solving skills which we need to prevent mental illness. This should be taught to future parents. Child development, attachment theory, parenting strategies, they should be part of the curriculum. Recognition needs to be given to the importance of play, sports, arts, drama, as well as the additional difficulties faced by disabled children and children with a learning disability. Mental and physical health are interrelated. Our bodies and brains are part of the same system, and we need more recognition of the importance of lifestyle factors like diet, exercise, sleep, and good quality relationships on children's well-being and mental health. The strategy should point to all of these issues and recognise the need for cross-departmental cooperation and the involvement of primary care and the statutory and the community and voluntary sectors to address them. The strategy doesn't include actions that are specific to third level students, and yet we know that the transition to college and university is associated with increased stress and high rates of suicidal thoughts and behaviours. Just reporting from a recent study that I'm doing in my university role, 26% of the students reported suicidal ideation, and 16% of the students, they had this in the year prior to going to university. Anxiety, and that was prior to the pandemic as well, actually. Anxiety-related mental illnesses emerge in early adolescence. However, late adolescence is the time when we will see the onset of symptoms of depression. And early treatment there means that we can prevent comorbidities such as substance use and other disorders, and we can reduce the impact on education and employment outcomes. Consideration needs to be given to the expansion of student mental health services with clear links to the university and college wellbeing services. And the strategy needs to specify that colleges and universities can have referral pathways to mental health services in the statutory and the community and voluntary sector. Universities and further education colleges need to be equipped to achieve this whole institution approach to mental health and support and services. Action 4 in the strategy is enhanced and accessible mental health services, and this should include early intervention for young people who are engaging in behaviours that are characteristic of dysregulation, such as self-harm and aggression. I would propose that psychological consultation and supervision is available for health visiting services and for other groups who are working with young people and children in the early years, so that they can identify the early signs of difficulties and offer appropriate support. Action 6 supports accessibility and promotes this no wrong door approach. But mental health inequality are relevant here too, as is the need for a trained and culturally competent workforce. It's important that CAMS services are located in non-stigmatising facilities so that we can improve access. And there needs to be outreach into marginalised communities so that the services are accessible to people who identify as LGBT+, travellers and children and young people who are in contact with the justice system, children who are homeless or at risk of becoming homeless. And we also need to include digital access as an important element of this action, and address digital poverty, because that could be a barrier that needs to be addressed. Again, pointing to the need for a cross-departmental plan. Crisis intervention services that are accessible for children and young people are required urgently. These services need to be trauma-informed, and that means compassionate interventions in collaboration with emergency services, as well as the community and voluntary sector, who are doing a lot of great work in terms of crisis provision. They should be accessible to young people who have used and use substances and people with a learning disability. Co-production is vital to understand the models that work and why particular models aren't so effective with this group. So it's great to hear about the engagement that's already happening. Young people tell us that they want confidential, non-stigmatising walk-in services in the community and services that they can access through their mobile devices. The links between crisis services and mental health services need to be seamless. Again, the no wrong door approach is absolutely central. Finally, and actually to mirror what the Children's Commissioner has just said, I worry that we're placing far too much emphasis on accessing services rather than focusing on the experience of young people when they do receive services and the outcomes for them. I was very moved by the comments from Dr. Claire McCauley following her recent study of young people's experiences of mental health services. And I'm going to end with this. Young adults describe being on waiting lists for very long periods of time only to get access to services and find the experience demoralising, disengaging and despairing. They acknowledge they often struggle to find the emotional language to describe their difficulty, creating a significant communication barrier. They wanted to talk to someone, but when they did not feel heard or understood in their crisis. We must do better. Thank you.
Thank you, Professor O'Neill, and thank you, Commissioner, as well. Reflecting just on the meeting last night with the young people, and many of the issues that they raised have now come up today again. So it just demonstrates how on the money those young people are in relation to what the problems are. It's our second significant engagement with young people. Our previous one was in relation to around the children's regulations, the COVID regulations, and that too was raised last night. And I think we are probably all pleased that the department has decided now, as of last Friday, those will not be proceeding any further. And I think that's to be welcomed. I do share the concern around the whole issue of data and outcomes and that. And I mean, we are all on the same page about what the problems are and largely what many of the solutions are. But there is a lack of detail around how we're going to get to the outcomes, what the outcomes even are wanted to be, and how we're going to measure those. And I think that's something that we really need to get to grips with. It cuts across into physical health as well, but it clearly cuts into mental health, and in particular in relation to health inequalities. So and mental health inequalities. So it's no longer, I think, acceptable to just list out the problems. We need to be underpinning those with the solutions and the planning to take us at least some way towards that. We're not expecting anyone to come up with a magic solution overnight, but just an example, when we were speaking with officials last week around inequalities and we asked for what the measurement on the outcomes were, we referred to the feedback forms. And that's why the feedback forms are important. They're superficial to an extent. We need to see the actual outcomes. Are we spending the right money or the right resources? Is it delivering the right outcome? And how do we learn and improve and make the system better as we go forward? So I think those are areas that we certainly agree, and I think we're putting an increasing focus in the committee in terms of around that whole data collection, how that's being used, how that's measured going forward. The other one I wanted to pick up on, Koulla, and you had mentioned there, was, and it came up very strongly last night and very articulately by the young people last night, so I welcome the opportunity to raise that today with you, both of you, in relation to your role. But maybe Yiasouma, in the first instance, reneging on exam commitments, and it was very clear that is the case now. And while that is an education issue largely, the impact of it is health, and we're seeing the impact of it on health. So in relation to that, Koulla, what are you, particularly at this present time, how are you engaged in relation to addressing that issue, or what can be done to try to deliver on the commitment rather than allowing it to be reneged upon?
Thanks for that question. I just tweeted, ask me any question. I didn't mean ask me really hard questions, but I think that's a really important issue, and I think, and I will hold my hands up and say I was not prepared for the level of testing that our young people were subjected to, the speed by which it happened as well. It happened so quickly after they came back, some in the first week, but certainly for most of them after Easter. And also how quickly some schools went straight into exam mode with the sort of exam timetable that would have been pre-COVID, i.e. you only come in when you have a test to do. And so that didn't give the opportunity for many of our schools and our teachers to actually connect with the young person and find out what was going on for them. And now the issue is, Chair, is that now most of them are finished. Most of them are done and dusted and are at home and have finished for the school year. Certainly our GCSE and A-level students, our AS students have gone back in, but our GCSE and A-level students have finished. And I have tried and to engage and ask for schools to come up with a program. Now, we will have heard of some schemes that have been funded and set up. And I'm hoping that a lot of those will reach out to certainly our year, what we call year 12s, those who are going into sixth form next year. And I'm hoping, well, I'm not hoping, we will be advising that there should be bespoke programs for them. But I have been disappointed by the way this was all set up. We are now having those conversations with regards to appeals and after the grades have happened. So to make sure that we're not in the same mess that we were last year and the young people believe they were treated fairly. What I do want to say is that because of how quickly this happened, I did make the decision that we wouldn't try and stop it because we felt it might be more destabilizing for our young people to change a process midstream. And I want to just say how in awe I am of our children, of our young people who have stepped up and who have done what has been asked of them. And I hope to goodness that everyone recognizes that and doesn't mark them down for those stress. So in the appeals process, if they have been stressed and it has affected their performance in these assessments, then we will look to support them to make sure their experiences are heard. I can only apologise that this happened so quickly. And say we did everything we could to try and get schools to reverse and take a more measured approach to gathering evidence. But so many of them went to these tests, and I think they should be called exams because that's exactly where they were. Because many children set them in exam conditions. And can I? I don't have a great answer for you. What I do have is we need to reflect. What this has done has, and what happened with transfer last year means we have to reflect on what our education system thinks is important, because academics of subjects and academic learning and achievement is important, but it's not the only purpose of our education system. and we need to maybe, and I've been recommending this for almost 6 years, have a well-being measure that each school has to report on in the same way they do with academic attainment, so that we learn to value both issues. And just very quickly on your first point around outcomes, you're absolutely right. And we published, we looked at all the CALMS data that was published, and approximately in 2019, 2020, 42% of our young people left our CALMS system with their goal not achieved, either not achieved, partially achieved, or the young person disengaged from the service. That's not good enough. That's not that's not what I would call an effective service. Now we need to understand what that means, but you're absolutely right around outcomes data.
Yeah. Thank you, Koulla. And it was very clearly an issue, and I have to say there's also huge issues of inequalities there, because how are they assessing the impact of lack of access to broadband from rural kids, children of frontline workers maybe who didn't get the same support? Like, there are so many potential inequalities here to add to the testing mix, and I think you're right. I think we do, because again, there's an old adage in business, and I was in business for many years, what gets measured gets done. So if we don't measure well-being, then are we really moving towards it? So we have to understand what we value and measure what we value and plan for it.
Absolutely.
So thank you, Siobhan. The second one is for you, and it's again emerging from the young people that we spoke with last night and met with last night, and it's in relation to access to counselling and support and things like that there. And some of them raised the benefit of that being in schools. Others mentioned that youth clubs would be a setting where they thought there was some potential to engage young people. And others still made the point, and very, very accurately, I thought, and very wisely, that not everybody goes to youth clubs either, and they were wondering, is there potential within schools and within other settings? So I'm just wondering, Siobhan, what's your views on that, or is there anything within the planning that will lead? And I'm also conscious of, in our previous session where we talked about walk-in availability in communities through that no wrong door, that we have a door within communities people walk. So could you outline what you think could be is being done on that, or can be done, to improve access?
Okay, so there's a lot of initiatives that are helping improve access. I think the Text and Nurse scheme that the Department for Education launched a number of weeks ago was very helpful there. I think the need that young people have is for immediate support when they perceive that they're in a time of crisis, and they call it a crisis, and that's what they want it to be identified as. So the Text and Nurse scheme, very useful. I think we should really be expanding the whole digital health action in that mental health strategy. We could be using digital technology in more novel ways, although we do need to consider the access issues there and digital poverty. But young people use their mobile devices and they live their lives sometimes through those devices. So those devices, we need to be exploiting that in order to help them access mental health services. The school vision is being improved right now, and I think it's very helpful that we're moving towards counselling in schools, although recognising that the term counselling might perhaps be inappropriate, because in many cases we're talking here about play therapy for the younger children and family therapy, recognising that the child and young person's mental health is hugely influenced by the family that's around them and the relationships within that family. And for that reason, I've also recommended that the talking therapy hubs include family therapies and even relationship therapies, because, I talked about childhood adversities, and the number one adversity that our young people experience is parental separation. And that's not always and needn't be a negative adversity. It can be a way of modelling negotiation, conflict resolution, all of those things. But, parents need to be equipped with the skills to manage that process so that it doesn't have a detrimental impact on young people's mental health. So the talking therapies, the hubs are another potential route through which young people can access mental health services. The community, the youth sector, absolutely huge area there that could be expanded. The Crisis Cafe model is an excellent example there of something that's working really well to provide support for children and young people. And I think even support for children and young people before they access the formal child and adolescent mental health services, so that they're equipped to describe their emotional pain, so that they're prepared to undergo that treatment process, would be very, very useful, and maybe would reduce the numbers and the proportions there that are accessing services and feel that the services aren't meeting their needs. And in relation to an earlier point, I think we do need to define recovery and start to try and measure recovery. And thankfully, that's in the strategy. It's supposed to be a recovery-orientated strategy, but that does pose a challenge. How do you measure recovery? We're used to measuring sessions delivered, treatment completed, 6 sessions, all of these types of things. So how do we measure recovery in a meaningful way? And how do we do that wraparound care? Because treatment is only one part of recovery. We need to promote those social networks, those social structures that actually mean that young people can develop and flourish following treatment for a mental health problem. So even access to recovery colleges or that type of model for children and young people will be very, very beneficial in addition to the formal services. So not all of this is going to be done in the statutory sector. The community and voluntary sector are absolutely crucial providers here. So there's an action within the strategy about the integration of the community and voluntary sector and the creation of a single regional mental health service. And that must be delivered very, very quickly in the term of the strategy, so that all of this can function appropriately for children and young people.
Thank you, Siobhan. So I'm going to go then to members. So I have Paula, Pam and Carol indicating at this stage. So I'll go firstly to Paula there. Go ahead, Paula, please.
Thank you, Chair, and thank you, ladies, for coming along this morning. I suppose my first question is to follow on from what you've just mentioned there, Siobhan, in terms of the impact of divorce and separation on children. Last night, a group, a UK-wide group, launched the Parents' Promise. I don't know whether you saw it on Channel 4 News, and that was really about those conversations, just in case we separate. So just wanted to see if you could expand maybe a wee bit more in terms of how you think the children are impacted, since we've seen a huge rise in separation through COVID, and even more practical steps in terms of how the young people can be supported either in school or in a community setting. So that's my first question. Thank you.
Okay, so one of the first things I did when I received the copy of the prevalence study with the 35% figure is ask the researchers to do reanalysis of adversities, but taking that as an adversity out because of the wealth of evidence now that shows that that's actually a very common experience, and it can have a very, very positive impact for young people. So, I mean, defining this as an adversity, I have difficulty with that for starters, and I think it also makes me think about a study we did of college students, of university students at our own university, where we found that actually the group of students who had no adversities were actually at moderate risk of having a mental health problem, and it seemed that they didn't have the resilience and coping skills to deal with the ups and downs of life and the problems that university that transition brought. So I think we need to move away from the idea of all adversities as being negative, and we need to recognise that relationship breakup, separation, management, negotiating conflict, this is all part of life, and we need to embed these skills from a very, very, very young age and model them. So it's about the rupture and repair work that we do with our toddlers to show them that, yes, there's always conflict, but it's how we repair that conflict and what we do. And that needs to start, as I say, it needs to start in the early years and needs to be developed all the way through the curriculum at school. And then, of course, families need that support. And I want to see it in solicitors' offices. I know Relate are doing great work there, but the place where you go when your relationship and your marriage is breaking up is a solicitor. So I want this across society, a recognition of the importance of relationships, but also the importance of managing those conflicts and negotiating and all of those things. And it also helps in terms of peace building. So what we're building here is a generation of young people who are able to negotiate problems, who can deal with conflict and can work around conflict and prepare solutions. And that's what we need going forward to make Northern Ireland a more peaceful place. So this is benefits and pays dividends across society.
Yeah, no, I agree with you. And I suppose, as you say, a lot of it ends up in the solicitors and then in the courts, these protracted, acrimonious separations. And I suppose we're making our children deal with adult issues. And so, yeah, I totally agree. Intervention earlier on is far better. My second question is to you, Koulla, and that's really around the issue raised with the Minister there around eating disorders. And I suppose some of the parents had come to me, it was off the back of their girls in particular, who were very sporty. They weren't allowed to do any sport because of COVID, put a wee bit of weight on, and then, things started to spiral, all the other stuff. So I'm just wondering, as we come through COVID, what can we be doing in terms of ramping back up the sort of links between mental and physical health? And if you think that there's enough being done, not just within the Department of Health, but right across Department of Communities and Education, to ensure, in particular, young girls who fall out of sport, that they do see it as a very valuable way of protecting their mental health as well as physical health?
I think you're absolutely right. There's been a lot of talk about, and quite rightly, about mental health and emotional well-being, but it is absolutely right. I actually, this morning as I drove in, I'm in the office, I was thinking, God, Koulla, your spirit is uplifting. That's because over the last 3 days, I've managed to get out on my daily walks. And that's just me, a middle-aged woman, just getting out on my day. It gives me an excuse to eat more chocolate. But do you know what I mean? So we do have to remember, particularly in this weather, but any weather, that sport, and that it is not about one thing. That if we're going to be happy, we need to be holistically happy. We need to tend to all of ourselves and be healthy and well. The eating disorder, specifically the eating disorder piece, is actually very worrying. We do need to up our game in Northern Ireland particularly with regards to quickly accessing services, but also finding a way that we can make sure that in our schools and in our services, in our generic services, that people do understand what needs to be done when a child is experiencing an eating disorder, but also that in our acute services, in our hospital services, that we are also we support those services to be able to better respond to those young people. And you talked about girls, but also we know there's quite a hidden issue with boys, because when we think eating disorder, we think girls, and the figures demonstrate that is an issue with girls, but also that we know it is quite hidden for boys, and we need to bring that out in the open as well. So that there is a piece of work to be done there.
Thank you, ladies.
Okay, thank you, Paula. And going then to Pam. Go ahead, Pam, please. So I'm not there. I think I've seen. Okay, Pam, go ahead. Yeah.
No, it takes a wee minute or two for that system to allow you to unmute. Thank you, ladies. Thank you for your attendance, and I just want to say from the outset that really do appreciate the work, the good work that you're doing, and how you're advocating for children and young people, and those with mental health problems right across our society. So thank you for that. I have a question for each of you today, and the first one's for Koulla, and it's. I mean, obviously there are going to be really difficult constraints within the budgets, but I wanted to ask you around the still waiting recommendations, and could you tell us which parts of those recommendations do you believe should be prioritised as part of the recovery and rebuild post-COVID-19?
Thanks, Pam. You're asking me to choose between my many children with still waiting, and I find that quite difficult to do. But I suppose we have, as it sits at the moment, we have 33% of the recommendations of still waiting still in red, and so they're the ones that would worry us the most. And it's not always about money, Pam, to be honest. It's not always about money. It's sometimes about changing our mindset. So it's attitudes. So one of the things that we do need to progress on is the pathway that young people go on if they feel they need additional supports and services. And we've already talked about they don't all need to go into child and adolescent, the statutory health services. And sometimes that's seen as the only route, and the use of the GP in that process can sometimes be problematic because the GPs don't always have the training or the skills or the knowledge to be able to understand when they can refer back into the community and voluntary sector, and generally refer on into CALMS. And that is a pivotal point, that pathway. So that I am concerned that hasn't progressed the way it should. I'm really concerned at the lack of progress, as I said in my introduction, with regards to children with learning disabilities and disabilities, and also with children who use substances. And we know, particularly for those young people, that they're almost self-medicating. So, we need to find a way forward for them. I was interested in what the Minister said about a mental health trust. I think it's certainly an interesting proposal. But for services like this, for children who have particularly learning disabilities and a mental health issue, but also drug and alcohol misuse, I think we do need to have a regional support, because the disparity in services across Northern Ireland are extremely worrying. And I suppose the other thing is as Siobhan has already said, the ability to access services earlier and quicker in the community, and a proper partnership with our voluntary and community sector and with our education system is absolutely critical, because we need to prevent young people becoming so poorly that they need CALMS. And what we know is there's a very vibrant voluntary and community sector, and also so that needs to be shored up, and that proper partnership. And my final thing, again, to reiterate what Siobhan has said, is primary schools. We need a bespoke, age-appropriate range of interventions that children and families can access in primary schools. And I think we need to move away from using the language of primary school counselling, because that's not necessarily the model we want to talk about these wee ones. But we want something that is appropriate and that can bring in the whole family. And then I said finally already, haven't I? But finally, really looking forward to seeing how the perinatal strategy and services work through and how they're implemented, because again, that will very neatly fit into the early intervention process. So that's, off the top of my head, some of the issues that we really need to progress on, as well as all the data work, so that we have a better understanding. I hope that answers your question, Pam.
It does. Thank you, Koulla. And Siobhan, for you, I suppose, in a very similar vein, and given the budgetary climate, where do you believe funding should be prioritised within children and young people's mental health services to have that maximum strategic benefit?
Okay, it's a great question, and it's very real, because that's the world we're living in. There are restrictions, and as Koulla said earlier, it's not necessarily about funding. It's about using the money that we have in a better way, and so I think that action one for the plan for early intervention and prevention, I think that the plan itself is not going to cost so much. The implementation of the plan may well cost more, but that needs to be done straight away, and it needs to be cross-departmental. And then in terms of services, we're already reviewing crisis intervention services, so that should happen very quickly. But I think making sure that those services are accessible to children and young people, and improving the crisis support services for children and young people, they are easy wins that will prevent the escalation of mental health problems further down the line. Because often when we're talking about a crisis, we're not necessarily talking about a mental illness. We're talking about a life event. We're talking about an opportunity for helping a young person find a way of managing and developing coping skills and developing that resilience that's going to serve them well. So if we can respond appropriately at the time of a crisis, then we are setting children and young people up for good mental health and good coping and problem solving skills. So those are the two things. The changes that are in the framework for education are also really important, and we need to be moving on those, so that we are helping young people recognise the difference between stress and mental illness, making them more self-aware, developing those problem-solving skills. Again, none of the stuff is very, very expensive, but it will be so important in preventing mental illness further down the line.
Thank you very much. Thank you. Thanks, Chair.
Thank you, Pam, and thank you, Koulla and Siobhan. And I'm going then to Carol Nicullen, and then I have our Leah Flynn indicating, and that's the indications I have at present. So I'll go back to yourself there, Carol. Go ahead, Lydia Hall.
So thank you very much to both of you, not just for being here this morning, but just for your ongoing advocacy on behalf of some very vulnerable people, to be honest. The thing I find really frustrating is, and it's going to sound like a contradiction, on one hand there now is a mental health action plan, but on another there's a lot of strategies floating around and it's trying to tie up where their priorities are. So I found this morning my experience has been very negative, and I can't see that changing, and that worries me. I'm seeing talking therapy hubs, being contracted out, and so it's about the contract rather than where the needs are, and then wrapping the contract around that. So that hasn't happened, and I really think that needs to change. So that's just your thoughts on that. Secondly, I completely agree with both of you in terms of the need to look at the needs and then see what funding is needed after that. And I haven't heard that happening either, despite it hasn't happened. And Siobhan, you'll be more than familiar with this, and I've no doubt our Leah Flynn will be talking about it because she's actually championed it. The issue around crisis intervention is really urgent, and I'm not seeing that highlighted and promoted in the way it needs to be. So we had an incident on Monday in the Royal Emergency Department. Now, a lot of the people went to their GPs. Monday's the worst day for EDs. But you had youngsters sitting there in mental health crisis, and they just leave them thinking they'll sober up, and a lot of them are getting up and walking out. I can't get them to engage. They've lost all hope, and whenever they do get services, I would go as far as to say at least two of the families I'm dealing with were traumatised as a result of services and that. And I know it's not the intention of people to do that, but it wasn't what they needed. And unless we very quickly make that urgent, then I don't see how these issues are going to change. I really don't. And I completely agree with you in terms of play intervention and that, because I'm now seeing 3 generations in Belfast where very young children are very anxious. I'm talking about 3-4-year-olds are very anxious because of the anxiety that's been and the trauma that's been intergenerational. And they don't need to go through a statement and process. They need talked, they need supported, they need helped. So it's just how we're going to get these issues, if you agree that they are urgent, how are we going to get the minister or ministers to actually take them as urgent issues and act upon them, more importantly? Thank you.
Oh my goodness. Right, okay. I knew you would ask. These are really deep-seated issues that need to be addressed. So if we go with the more simple, straightforward one, which is around when we did Still Waiting, we found over £31 million was spent on children's mental health and wellbeing services across 93 services across a range of sectors and systems. And you're absolutely right. Those services could all talk about the numbers of young people attending, and what intervention was offered, but they weren't as good as they could have been around what was the outcome achieved. How did we move? So you're absolutely right. If we're serious about outcomes, we need to be serious about understanding what those outcomes look like. And then that talks to we need to be joined up. So we've had in this last week, and I know Siobhan agrees with me because we had this conversation earlier in the week. In this last week, we've had quite a number of announcements about additional monies for various services, and particularly over the summer, which is fantastic, absolutely fantastic, because you've just heard me say for some young people, schools finish too soon. But I'm really worried now that we now have the councils doing things, voluntary and community sectors doing things, youth services, the EA Youth Service doing things, and our schools doing things. Now, that there is quite possibly a need for all of them to do things, but where is the overarching mechanism? Where is somebody in a room or in a community with those communities going, right, what's going on over the summer? What is it you need? And how are we going to draw it down? So this, and again, this is another mantra, this one community, one plan is really, really important that we understand what's going on, Carol. And you're absolutely right. Also, Northern Ireland and in lots of places, we're really good at action plans and we're really good at strategies. And then we breathe a sigh of relief when it's done because now we know what we've got to do. But that is less than 10% of the work. 90% of the work is getting the job done. And I don't underestimate the challenges, particularly in our health sector as we come out of COVID. Not enough money, huge waiting list. Adult social care is on its knees, and we've just seen how on its knees it is, and it needs massive investment and support. And so do our children's services. And I don't envy the job, but at least we need to start by understanding where we're at. And that the money that we spend currently is spent well, and I'm not sure what more can be done unless we can get a government that understands, is on the same page as this, and actually works together, and isn't talking about this is what I achieved in my bit of the house. Is able to say, as 9 departments, this is what we've achieved as the government of Northern Ireland, with and for the people of Northern Ireland, and including our children and young people. Now, these sound really aspirational, but it's not that difficult to have one outcome or a shared of outcomes as we're planning with the programme for government, and then putting the money together that we're spending across the different agencies and different services, and saying, right, how are we going to achieve making sure our children get the best start in life? What does that actually mean, and how do we achieve it? And communities, put your money in the pot. Education, put your money in the pot. Justice, well, actually, justice, get out of the game. But anyway, put your money in the pot. Health, put your money in the pot, and let's do this together. We need to stop making this about individual services and individual departments, and start making this about the whole government for the whole population.
Yeah.
Okay, can I compare just onto being more specific? Sorry, Colin, is that all right? Okay. I wanted to respond to the strategy. I think we're at a time now where we have a draft strategy and we're waiting the final version, and a lot of things are kind of put on hold until we get that. I've been assured by the Department of Health and the Minister that the final version of the strategy is going to be available very soon, probably around July time, and that's going to come along with an implementation plan. And that's where the role of a mental health champion is really going to be important, and monitoring the actions within the implementation plan. So that will set out, and certainly there'll be year-on-year actions. It won't be achieving everything, but there are things that need to happen straight away in terms of reorganising the system, and then we can start to make the changes to particular elements of the mental health services. So we need the workforce planning, we need the central mental health service, we need the integration of the community and voluntary sector. We need those sorts of actions straight away, and then we will be able to hopefully see the changes to the services that will make them better, and there will be groups then that will be driving forward the actions within the implementation plan. So I'm hoping that should the benefits there should be seen very quickly. In terms of crisis services, that is very urgent, and just this morning I've asked for an update on the review of crisis services to find out where we are, when that team will be reporting supporting and what they'll be recommending. And certainly the need is to go beyond the de-escalation. And it's supposed to be de-escalation. It's not supposed to be traumatizing. It's supposed to be de-escalation, and that's not what's happening. But that one-off de-escalation is not a suicide prevention model. Suicide prevention model is where you introduce safety plan and follow-up. And the Scottish system that I keep pointing to, Distress Brief Intervention Scotland, provides 14 days of continuous follow-up for people who present in a crisis. We need something similar here. The community and voluntary sector are a crucial element of that, as is the training of our emergency services and the staff within emergency departments, so that we don't have this revolving door where people present again and again in a time of crisis and don't receive the care and the follow-up and the support that they need. So all of that's crucial. The mental health strategy, the final version, will also be published with a funding plan, and I know that they're working right now on that, and they're using models from other jurisdictions to base the funding, the indicative cost of each of the actions. So that should come along with the strategy, and then we need to demand from the government that there's money for this, and it won't be found within health. It's going to have to come from other places. So we're going to have a big conversation there, and other things are going to have to be set aside while we focus on this, knowing that by investing in mental health and by investing in early intervention and crisis intervention, that we will be creating a healthier population, and we will reduce the demand and reduce the cost of mental health, which is substantial.
Thank you, Carol. And again, I think that's a crucial point there, and I will declare the interest of having worked within social work, including within mental health and within children's teams. If we could only start to get the interventions in earlier, we will eventually see, I think it's widely accepted, we will eventually see actually cost savings as well as better outcomes, but we have to prime the pump to make that happen. We have to have the workforce and all the elements in place. So that's a crucial thing for us to have a conversation around and get that delivery. So I'm going then to Orlia, and then I have Chiara after that. So I'll go back to Orlia Flynn, please. Go ahead, Orlia.
Thanks, Chair, and thanks, Koulla. And Siobhan, maybe just to follow on then from what you were discussing there with Carol. So, and I didn't want like today's conversation to be in any way negative, because obviously it is Mental Health Awareness Week, and I had no intention of sort of directing it that way. But to be honest, after the briefing from the Minister this morning, there's no other tone that I can take, and I know that both of you have mentioned a couple of times about it's not necessarily about the funding, and I get that. We've already spoke about the workforce and all the early intervention stuff and all the cross departmental stuff, but from my perspective, I have been raising the issue of mental health literally in every single committee meeting from the health committee set up again, and for all the good and all the progress that we've seen. And like I call that out each time, and I've commended the Minister and the department. Each time I can just hear a wee bit of feedback. I don't know if everyone else is on mute.
Yeah,
so
I'm getting
that.
feedback as well there earlier. So just give me a second, earlier. Can I just check with broadcasting there that everyone is on mute? There is a wee feedback coming across on the line. Try it again now, earlier, to see if that improves it.
Yeah, thank you. So for all the positivity that we've seen, I just feel really despondent from today's briefing and from the briefing that we got from the health officials a couple of weeks ago around the money to follow up on these strategies, because what we were told, clear enough from the Minister's own words this morning, it's not there. He did set out that there isn't funding to deliver on all of this, so I am concerned about that. And I get, Siobhan, when you talk about demanding from government that we need to see action on these pieces of work, and we should. And I'll speak to anyone who'll listen as well who can help out and delivering on some of this. But my concern is just that the health department is the lead department for mental health, and we've been banging on forever about, Koulla, you had mentioned it, about the percentage of the budget share and the Minister mentioned it himself again this morning as well. It's historically been underfunded, so we know all this. We know that the NCAMS is getting the breadcrumbs from, a really, really small pot of money as it is. We know addiction services and drug and alcohol services are getting 8 million of the overall health budget, which is tiny. It's minute, and it's just I am just getting frustrated. We've seen the health inequalities report that come out the other week, and all the stats and the data is telling us that more and more people are dying. The amount of drug deaths have trebled over the past 10 years. The health inequalities in the most deprived communities are the gap is widening in terms of mental health, drug and alcohol indicators. So we got the breakdown of the amount of antidepressants that have been prescribed just from 2018, and the constituencies of Carl and I represent North and West Belfast. I'm not being parochial, but when you're talking about deprived areas and where you're actually seeing the severe outcome of poverty and deprivation and poor mental health, it's in the communities that we live. And I think that's some of Carl's frustrations earlier on about the families that she's meeting with and dealing with. I'm dealing with similar cases as well. And I think that, even in North and West Belfast, the amount of antidepressant prescription forms from 2018 have increased by 40,000. So it's madness. And I don't know if you are feeling the same concerns that I'm feeling, that it's great that we have all the strategies, but where really is this going? So listen, just to sum it up, I suppose my question to Koulla, yourself as the Children's Commissioner in terms of mental health and young people, and Siobhan, yourself as a mental health champion, what can you physically do, practically do with the Department of Health and with the Minister in the time ahead, just to try and make sure that, that we're trying to push this as much as we can, because I just think it's going to be almost a waste of a lot of good work if we can't get the funds to deliver on it. And just your point, Siobhan, on the crisis review, I don't know if you heard earlier the briefing that we had from Thomas, but he was saying he's getting that review to the Minister shortly. But I suppose then on the plus side, he was saying the review is more comprehensive than what they thought it was. So there's obviously loads of good detail there, but it's just getting to the point that yes, we'll have the detail, yes, we'll have the reviews, yes, we'll have the strategies. So where's it all going?
Siobhan, do you want to go first?
I was worried you would say that. No, this is huge. This is what keeps me up at night, honestly. The strategy is going to be really good, but it does need to be funded. In terms of your question, though, what can we do practically? Right. So as interim mental health champion, what I can do is make sure that we are not wasting the money that we have. And that when we're spending money, that at least we spend it on actions that are going to make a difference and a positive difference. And, improving mental health and providing services, it's not always intuitive. And some of the things we're doing, we could be more efficient in the way that we're working. Those crisis intervention services are a really good example of how an intervention can save a lot of money further down the line, an early intervention, a quick intervention. So we need to use money that we're spending, we need to use that wisely. And I think in terms of my role, that's what I want to focus on. I want to look at really making sure that what we're doing and the expenditure that we have is being spent effectively and in a way that will support people and improve people's mental health and reduce any duplication in the system. I think there's a lot of low-hanging fruit, I would call. There's a lot of staff who are really keen to be involved in mental health and prevention, who want to deliver interventions, brief interventions. So there's training that we could do there across the workforce in mental and physical health that would mean that people receive interventions at an earlier stage. That is not necessarily going to be costly. There's lots of free online training programs that health service staff can avail of, that want to avail of. And I've certainly seen so much of this in the past year. There's an appetite out there for change. Nearly every group in charity, regardless of who they're working with, they want to be doing something in terms of mental health. So we need to really exploit and capitalise on that, so that we are cascading mental health interventions and wellness across society, and making sure that everything that we do in every government department is promoting mental health and wellbeing. And we need to monitor the implementation of the strategy, so that even if there's not an increase in funding, and we know there needs to be an increase in funding, but at least that what we're doing doing is that we're using the funding well. And as an academic, I can point to sources of evidence about what works and what we could be doing differently and what we could be doing online and digitally, for example, to reduce costs, to save time, so that we have those face-to-face interventions for people who really need them and for people who would benefit most. So that's my offering there. But yeah, this really concerns me, and I'm keeping a very, very firm eye on all of the developments, particularly when that strategy comes out and how it's implemented.
I'm glad you went into that detail, Siobhan, because Leah, I suppose I want to say that obviously that there is some despondency with regards to where we're at with money, but I just want to reflect on the 6 years that I've been Children's Commissioner and the journey we've been on in Northern Ireland with regards to mental health. Particularly for our children and young people. We're in a very different place than we were 10 years ago because we're talking about it. We're encouraged. We've begun to, we're not there yet, but we've begun to remove the stigma. We've begun to understand that there is a continuum of emotional well-being right through to mental illness, and that what we want to do is keep it that. We're encouraging our young people to talk about it. We're supporting our parents to support their young people. We're supporting our professionals to talk about it. We're also seeing young people demanding their rights when it comes to mental health and wellbeing services, and these are really positive things. I suppose from if I'm talking about a NICI point of view, alongside all the advocacy and the individual advocacy work we do with families, I am very proud of Still Waiting, because what Still Waiting did, having done all that work for 18 months, is actually across those 50 recommendations made very clear, specific recommendations as to the way forward. And my office is now invested for the next 2 years, which is as long as I have left as Children's Commissioner, and for the 18 months since publication, is to, if you like, hold the minister and his team's feet to the fire to make sure that they implement it. So we have tried really hard to make sure this strategy is not one for the shelf. And there are more services out there for young people. And I don't want anyone listening to this to think there's no services out there. There are. There needs to be more of them. They need to be embedded. They need to be holistic. But I do want to say we're in a different place. And you're absolutely right. There is not enough money in the system. We need to see more money coming from Westminster. But I want to finish, and it's almost also in answer to Carol's question. The mental health and well-being of our children and young people and our society generally is absolutely the primary responsibility of health, but its causes are found elsewhere. Its causes are rooted in poverty. Its causes are rooted in educational inequality. Its causes, as we've heard, are rooted in some family circumstances, a myriad of them, and unique to Northern Ireland, and we saw it so vividly on Tuesday. Its causes are rooted in our conflict, in your conflict. I've only been here 27 years, but its causes are rooted in there. And today's children there is no way that those 10 families and the hundreds of members of those families have not lived that trauma for 50 years, and their children are still living it today. I'm not blaming the families, I'm blaming the fact they couldn't get the answers to those questions. And until we can find a way forward in Northern Ireland around the conflict, very, very challenging. It's much easier to say than it is to do. Then we're not going to be able to respond and support our children and young people to have better mental health. So this is why I go back to our whole government approach, because we have to resolve poverty. We have to resolve our fundamental inequalities. We have to support our families. And we have to find a way forward for our community. And that's how we're going to make sure we need less money in our mental health system.
No, listen, thank you so much. And I just want to thank you both for all the work that you are doing around the issue. So thank you.
Thank you, Orlia. And the final indication that I have for this session is from Cara. So go ahead, Cara, please.
Thank you, Chair, and thank you both for being here. Just off the back of the comments already made by other members, I have a real interest around, the use of substance abuse, and I think this is kind of the aspect where health and education overlap with our young people. And I'd spoken with a few young people recently, and they've said the kind of education around alcohol intake and drug use they felt is really inadequate and quite outdated. And we know drugs at an earlier age can have no question they contribute to poor mental health in our teens, but also they can contribute to a dual diagnosis later in life. So I'm just intrigued to get an answer from yourselves. Can you expand on the gaps here, how they can be addressed, and what role you think schools can play in supporting mental health and education around drug and substance misuse? Thank you. It's a big question.
Okay, I'll come in on that.
Who's going to? Yep.
Well, I'll come in on that. Thank you. And that's a good question. Cara, I would just want to highlight that the framework, the schools framework, should include this as a risk factor, as an issue that needs to be discussed in schools. And we do need to move towards a greater awareness of the proportions of young people who are using drugs and alcohol, but particularly drugs. I think alcohol use has declined recently. So we need to be real about the fact that more of our young people are using drugs, and we need to know what they're doing. We need more data and evidence around this, and we need to address it in the school setting and raise awareness of the harms, but also provide an opportunity to discuss in the school setting what young people are using and the implications that will have for their mental health. We also need to reduce the stigma around drug use, and that's so very, very important as part of a bigger conversation, and recognise that most of our young people who use drugs will not go on to develop mental health problems as well. But when you have that overlapping drugs history of trauma, poor social support, poor relationships within the family, then you do create a situation that does increase the risk of mental illness for that young person. So it does need to be brought right into the schools, but we also need to be providing mental health services who are equipped to manage young people who are using drugs and alcohol, and the dual diagnosis service is a really good example of that. We need to be able to provide dual diagnosis services for young people as well as adults, and that means recognising that young people are using substances because of a history. They become dependent on substances because of a history of trauma and adversities and all of those things, and mental illness as part of that. So we need to be treating mental health problems and mental illness alongside addictions rather than separately to the addiction, and that's what's going to be needed. And the mental health strategy does address that, but I think we need just a broader understanding of how comorbidity operates and the commonality that is trauma that influences both mental illness and drug use there too. So those are my thoughts. Maybe Koulla would have more to say on that.
Yeah, thanks, Siobhan. Just to very quickly add to that, because I'm mindful of the time. This was, as I said, a focus of still waiting, and we made some recommendations, and we currently have that in amber as a way forward. It is too difficult for a young person who has a substance misuse issue to be able to resolve the underlying issues, and we know that young people with substance misuse issues are the ones who are more likely to die through suicide or overdose. In our children, in the young people's statistics, often alcohol, drugs particularly, are an issue. The substance misuse strategy or substance use strategy has talked about young people, but not in the detail that we would have liked, and I would have liked to have seen. So the reason it's still in amber is that we need to see more strategies. We need to see, as Siobhan has already said, services that are able to address a young person where they have young mental ill health and substance, or a trauma and substance, that they are able to do one without waiting for them to dry out and do the other, because it's like a chicken and egg, what comes first, and they have to, so we need services that are more available to them. need, as Siobhan has said, to remove the taboo. But also we know, and somebody mentioned A&E earlier, we have seen an increase in A&E referrals to calm services over the last few years. Between 1819 and 1920, it went from 27% to 42% because those, and it is, many are young people, obviously young people in crisis, but also young people who use substances. And because they feel they have nowhere else to go and their families have nowhere else to go to get them safe, to get them to a place where they can be safe. So there's more work that needs to be done, and we will be scrutinising the substance misuse strategy very carefully, or the action plan very carefully, to make sure it has taken into account fully children and young people and their rights.
Thank you, Koulla. Just apologies there, folks. I don't know if my camera was on, so just apologies for that. But no, those insights are extremely helpful. And I do note recently constituents have said to me there's been a number of teenagers, under 18s, presenting to A&E in those early hours, and there's a really severe lack of support, real life stories, and it's horrifying. But just back to I suppose the topic of local sport champions. I'm mindful of time, so I will try and be very quick on this. I know I've raised this at a previous meeting. Siobhan, you had joined us just around the role that local sports clubs, such as local GAA clubs, football clubs, rugby clubs, and we know that the chair had mentioned previously, oftentimes young people feel comfortable talking about mental health in youth club settings. Something a little bit more informal, a little less kind of a sterile, and I'm just curious to see if there's any more conversations around this, or what more's been done to promote mental health in sport. Thank you.
I can come in there on that one. Since I took up this interim post, I've met with the some of the leading sports organisations, including the GAA, Ulster Rugby, the IFA, getting all the names right, and they're all doing really great stuff. And again, this is an example of something that we need to be spreading information about. And it's not, they're not doing it with additional extra funds that are coming from health, and they're training people in mental health first aid. They've got champions. I think we should all be mental health champions, and we should be doing this in all sorts of settings, but sport's a great setting. And they're doing the suicide prevention work there too, and the Public Health Agency are cascading suicide prevention training so that those mental health champions within sports organisations who have contact with young people and intuitively know when their players and members of their clubs aren't well, that they have the skills to provide brief interventions and direct people to support and services at an earlier stage. And I've even had sporting organisations contacting me around providing services themselves, paying for services. They're doing a lot of amazing work there. So it's great, and we want to sustain that and continue that beyond the pandemic. So I think that's really important. And it would be good at some stage, and I think Pure Mental are one of the groups that have called for this, where we have a directory of support, which includes all of the different types of support provided through all the organisations, including sporting organisations. And many people will have this as through their clubs, and they're just not aware of it. So let's improve the awareness of what is available, as well as keep calling for funds to improve services.
And I think everything Siobhan's just said, and I think this has been one of the benefits of beginning to remove the stigma and talking about it, is that wherever a child is, a young person is, whether it's a sports club, whether it's a youth club, whether it's a drama club, whatever that extra, that when they say, or when somebody picks up, that you can ask the question, how are you? And you're ready for the answer, and then know whether you can do the little bit of looking after yourself, or whether you need to refer on, so that there is, going back to the no wrong door, that whoever that young person chooses to disclose their concerns and distresses, that person is able to deal with it in a way that doesn't shut down the young person, because it's an enormous privilege when a young person shares with you, whether you're the sports coach, whether you're the counsellor, whether you're the youth worker, and we need to make sure we're able to support those people to be able to respond appropriately.
Thank you. And yes, I do note, in the kind of rural areas within my constituency, those kind of sports clubs are the hubs. So getting in there and having that kind of champion is just so important. And oftentimes young fellas, that would be the safe space for them to really open up. So I appreciate your comments there. Just one last final one. I note from an educational perspective, it's really good to hear, the conversation around giving young people the vocabulary to talk about mental health, to understand anxiety and express how they're feeling. I know it is an educational question, but it is mental health. What do you think is the best mechanism? Do you think it is, mandatory workshops throughout the year for pupils to attend? Do you think we should have a class focused on health and well-being? Where do you think the gaps are? And from an educational perspective, what can we do more of, or what should we be pushing for? Thank you.
Okay, so it's all of those. It's embedding it into where we are, and it is having well-being classes in the way you would other. But it's also being able to identify those young people. So we've talked about nurture units. We know about nurture units in schools, but also other programs that are going accredited programs going into school. There does need to be a quality assurance mechanism here around some of the programs that are going, and make sure that we know that they will improve children's mental health. So some targeted interventions for some young people. But also, and it goes back to what I said at the beginning, there was a lot of talk before school restart about mental health and well-being. And those exam year kids, including year sixes in some cases, went back in and didn't feel it, didn't experience it. And so I think that for some young people, that bond of trust has been broken with their schools. And with the system, SEER and the Department of Education as well. I think there's blame or responsibility at all three doors, and there's no point doing a class here if actually you don't feel it in every other aspect of your life in school. So what does a well-being school, a nurture school look like? And that's, I think, where we need to have the conversation around that measure. Because young people, like as I said, one young person said to us when we asked them around that spark of positivity left me when I went back into the school, because it was all about testing and it was all about grades, which are incredibly important for the next phase of their lives. But they did feel that they'd been sold a pup with regards to their well-being. And so we can do all those things, but we have to experience them in the corridors and in the canteen, as well as in the classroom.
Mm-hmm. Okay.
Thank you.
No, thank you.
Okay.
Siobhan, do you want to come in? Or
I just want to say what Koulla said in a different way, just to get my spoken. Basically, no, I'm coming at this as a psychologist, from a psychology perspective. So let's give you that. So mental illness is a result of two things. It's a result of the amount of stress and pressure that we're under, and their ability to cope with that. So yes, we can give young people coping skills. We can help them problem solve. We can make them aware of their own response to stress and pressure. But we also need to look at the other side of it and look at the system within which they operate. And that means actually reducing the stress and pressure that we're under. So there's no point in teaching emotional regulation and problem solving and self-awareness if you have a whole system that is constantly piling on stress and pressure, and actually I would argue trauma to that young person. And Koulla's right, those relationships are absolutely crucial. You can't feel psychologically safe if you don't have that safe environment, if you're constantly under threat because you're marked and graded and ranked. That is the most shaming thing that we can do to any individual, and that's what we do to children every day of the week. And that is not a system that is about well-being and mental health.
Thank you, Siobhan. Just to finish there, I completely agree with both of your comments there, and I think what I've seen is the link that young people put on their academic achievement and their overall self-worth, and it is very sad that they've kind of been thrown back into the classroom, rigorous, kind of right back in there with exams, and it's just it presents a lot of difficulty. So no, thank you for your comments and your answers. Thank you.
Yeah, okay, thank you everyone for that really important session, and one certainly I think as a committee that we will want to continue to keep a focus on young people and keep an eye out on young people and see how we can work together. It's very reassuring that there are people like yourselves in positions of responsibility and that can actually contribute and impact on this debate in the very positive way that your knowledge, experience and passion for the subject can generate. I suppose just to touch on very, very briefly one of the other things that came up last night and was kind of a point of challenge in a way, but I think also something relevant, and it's around people being able to get the support when they need it, that it's accessible, and I think it's really important, that point that you underlined there about the immediacy for young people. It has to be when they're experiencing it. A long-term appointment, it just doesn't cut the mustard in that sense. But one of the points was, and I think Koulla, you had said, or Siobhan, one of you had said, about 1 in 8 young people will experience these. And I think it is also important. One of the young people last night said, it's also, while that message that it's okay to not be okay, I think has really been a very useful message and allows people up. But it's also okay to be okay. So while we're dealing with the problems here, I suppose we don't want to catastrophize it to the extent where all young people feel that. So I think that's maybe an important thing as well. But is there anything either of you want to say just in closing as well before we complete the session?
No, it's a big job. No, just to say it's a big job we've got ahead, and if we're serious, then we can do it. I am optimistic, and I do think, particularly, I can see the impact that meeting with the young people had on you, Colm, and I hope that you continue to work with them and work with us, because we can do what we can within the resources. We can be better. We can do better. And it's, I suppose, just to end, it's just okay to be you. And whatever it is you need, it's okay. And that's really how, and you are good enough. Not you're definitely good enough, Colm, but to say to young people, you are more than good enough.
Yeah, absolutely. I understood that. Not because I knew it. I knew what you were saying. Okay, and Siobhan.
Okay, I want to just go back to something that Cara said that actually triggered a thought. Our young people are really tied up with academic achievement, and it is so embedded in their sense of self-worth, perhaps in Northern Ireland more than other places. And the reason for that is that we have such huge inequalities in our society. So the consequences of not succeeding academically, they see that, and that's why we need to take a step back and look at the social determinants of mental health and really start to address those if we're serious about tackling mental health in our young people. And all of the other things will start to resolve themselves. And we're right, most of our children will be absolutely okay. They need to connect, they need to have fun, they need to enjoy themselves, and we need to provide opportunities for them to do that. And we need to continue to listen to them as parents, as politicians, as leaders. We need to continue to engage because they have the answers and they will tell us and show us how to do this.
Yeah, absolutely. Okay, thank you very much. And just finally from me to reference the point that again one of you made in the early stages around the Youth Assembly. It's an initiative that the Speaker has brought forward. It's very well advanced and they are currently recruiting. So I would want to say to all young people out there directly, have a look at that and get involved. Put your views across. If it were left to me, I would involve them much more than we even do at present, even though we're trying our best. But I think young people just bring a freshness, an energy, an honesty, and a genuineness to a lot of the discussion and solutions. So I'd encourage everyone who wishes to get involved in that Youth Assembly. Thank you both very much for attending our meeting this morning, and no doubt we will meet again in the course of our work. I think this is an issue that we are all determined to keep a focus on and to try to provide some positive impact and improve things for the future. So thank you very much and good luck for now to both of you and take care. Slán Liv. Okay, members, thank you. So I am going to move on. We have overrun a little there so far, so I'll move into correspondence, members, and I'd like to draw your attention to a number of items there. First of all, item 7.2 is a response from the Department to the Committee's request for further information on the temporary modifications to the Children's Social Care Regulations. The Department advises that it has decided not to proceed with a new set of regulations following the consultation process. And I think we have had some discussion on that, but I think that is in keeping with the evidence that we heard and with, I think, the view largely that the committee formed. And certainly I know that others out there who contributed to that debate in a very meaningful way, Children's Law Centre, VOIPIC and others, and younger people directly with us as well in the earlier manifestations of those regulations. So just to welcome that, are members content to note, or members want to say anything further on that issue? Content to note, thank you. So item 7.4 then is a response from the department to the committee's request for further information following the recent briefing from officials on a number of coronavirus health protection regulations. Do members have any comments in relation to that item? No, thank you. Members content to note? Yeah. Jerry, were you looking in? No, I'm not hearing back from Jerry, so I'll come back to him if it is the case. Have members any comments or proposals on any other items of correspondence? No, but not table papers. I'll go to table papers next. Jerry, were you looking in there?
No, Chair, I wasn't, sorry.
Okay. Thank you. So members otherwise content with the actions proposed on the correspondence memo? Yeah, members content, thank you. Moving on to table papers then. The table pack contains a number of further items of correspondence. At tab 7.10, there's a response from the department following the briefing on rebuilding services. The response provides further information on staff recruitment, on CAMS, mesh clinics and co-design co-production. Our members, I noticed there is information there and significantly more information than we have had to date around the co-design co-production. But remembers, there's very little detail in terms of who was consulted with. We see a lot of the activity in relation to the amount of meetings, but would members be content to seek further information from the department on the makeup of each of the working groups and subgroups? Should we get a sense of the breadth of the consultations? Members content with that? Yeah, thank you. At tab 7.13 then, there's a response from an individual in relation to presenting to the committee regarding the mother and baby homes, Magdalen Laundries. Are members content that I write to the individual to outline the committee's role and the ongoing work that we're doing on this matter? Yeah, thank you, members. So members, moving then to the forward work programme, and I refer you to the draft work programme at tab 8.1 of the pack. Are members content to note the forward work programme as drafted? Yeah, thank you, members. So, members, moving on then to our committee's consideration of the severe fetal impairment abortion bill. And I would like to now ask the clerk to give a brief overview on the responses to the committee's consultation. So we've had a consultation out there for a number of weeks in relation to this bill. And I'd like to ask the clerk to brief us on the committee consultation and the current work that committee staff are undertaking in relation to this bill. So, Clerk, could you go ahead, please, and brief the committee on this?
Thanks, Chair. It's really just to give members a brief overview of the work that's been going on over the past number of weeks. We're due to consider this item in more detail next week, where we'll have a chance to consider the submissions and to look at them. But all the submissions should now be available on your ECP packs in your bill folder. So in total, there was approximately 39 submissions from organisations. There was then approximately 75 submissions from individuals. And then there was the further campaign where we received nearly 9,000 email template responses in relation to the bill. So at the minute, what we're doing is going through the responses from the organisations to summarise that for members. We're also going through the responses from the individuals to highlight some of the points that were made in those 76 submissions from individuals, just to pull out the key points from them as well. As I said, there was a template of approximately 9,000 emails. It was the same template being used in each of them. So that will be provided, that's been provided to members as well to be able to see the template too. So we're hopeful that in the pack on Monday there will be this two summary documents, one in relation to the organisations and one in relation to the individuals. And then next week members will have a chance to discuss the the written submissions and think about who it wants to invite to give oral evidence over the coming weeks. Now, at the minute, we've scheduled 3 weeks for oral evidence sessions. So I think it's the 3rd, the 10th and the 17th. If members are wanting to hear from more organisations that would allow, then we'll have to look at either additional meetings or running slightly longer meetings on those days. So it was just to flag up the work that's ongoing, but we are going to publish the submissions from the organisations on the committee's webpage today, so they'll be available for the public to see. We're doing a wee bit of work with the individual responses just to make sure all personal information is redacted. So it'll take a wee bit of an extra couple of days just to make sure we redact all the personal information, but we hope to get them out on Monday or Tuesday and publish them on Monday or Tuesday. So it was really just to give members an overview of the work that's been going on at the minute.
Okay, thank you, members. So clearly that's going to be a significant item of work, and I do think that moving forward, we're going to have to be really conscious of time, and I thank and appreciate members for sticking very rigidly to sometimes quite curtailed times today. But as we go into the next few weeks with all the consideration of both bills that are in front of us at the minute, I think we're going to have to really keep a tight eye on the agenda times and try to stick to those to facilitate this consideration. So members content then with that as outlined by the clerk? Thank you. Any other business then, members? Do members have any other business today? Carol, go ahead.
So, Colin, albeit lately, I sent yourself and Keith an email. I recently met with Chesney, Julianne and Aidan from Chesney, and it was primarily around some of the care homes in Belfast, but it struck me that the work that they're doing goes right across, and I think all the members would benefit from hearing of some of their experiences and work, particularly in relation to easements around COVID, around advocates for families, around the department's approach, the concerns around RQIA. I mean, it was very, very informative, but it is something that I think members will really benefit from, in my opinion. So if we could maybe agree to put that in the forward work programme.
Yeah, and I think I do agree, and I do know the organisation. They have done some sterling work around representing families and that is an issue I'm sure that we're all concerned in. And maybe it would be good to hear from them. Maybe we should put it even a little bit further forward in the work programme, as long as it's in there. Say that we'll try to get them. So it'll take some of the pressure off maybe but our members agreed that we put that somewhere into the forward work programme. Yeah, members agreed. Thank you. Okay, members, the only final thing I want to do then before I go to the date, time and place of the next meeting is just to remind members that we have an informal meeting with 123 GPs on Friday at 2 p.m. and this is part of our additional work around the whole concept of Mental Health Week. So just to remind members, and it'd be great to see as many of you there as possible. I know Fridays are just as busy in constituencies as every other day is in the assembly here, but it'll be good to see you all there. So our next meeting then, members, will be on Thursday, the 20th of May at 9:30 a.m. via video link. Thank you for your attendance today, for your contributions, and take care, and I'll see you all then. Gormé agah, agus slán.